Call this meeting of the Waunakee Community School District Board to order at 7 p.m. We had our closed session at 6 p.m. and all members are now present. And so our first is to look at approval of the minutes of our previous meetings, which I believe there's 3.
Move to approve both sets of minutes.
Is there a second from Brian? Any errors or omissions or questions? Seeing none, all those in favor say aye.
Aye.
All those opposed? And next will be approval of the agenda and additions. There is one change, which is we will be taking off the co-curricular list from the end of the meeting. We'll be moving that to our next meeting on the 17th so that we can get the list totally scrubbed based on our decision of co-curriculars last week. Other than that, is there approval of the agenda?
So moved.
Second.
And a second from Jack. Any discussion? All those in favor say aye.
Aye.
All those opposed say no. And as usual, we go to our public comments. We have one person here in person.
So it's good to start?
Yeah, yes, if you just give your name, please.
Yeah. So
You have 3 minutes.
Yeah. So hello everyone, my name is Alec, and I've come here because I've recently noticed you guys all getting in the news lately, and I specifically just want to talk about the approval last time of the K-6 hybrid model for our school agers. And I just want to start off the bat by saying a lot of other school districts and a lot of other areas are having to handle a very similar issue, and a lot of them are coming across a very similar solution to this issue. Because, for example, one of the ones I found was Blount County in Tennessee. They actually ended up having they wanted to kind of keep kids apart as well, and they ended up wanting to stagger the start to keep people from infecting each other, keeping everyone healthy. But they actually started and had about a quarter number of cases as we do here in Dane, and they ended up, after the first day, having numerous cases actually break out. They thought they could keep it contained, and sadly they couldn't. So it's just something similar to kind of keep track of, as well as kind of like Georgia counties, or Howden County in Georgia. They have half the numbers we did, but as you saw from the pictures, they're very crowded. And I understand that you guys are going to want to keep everyone separate, 6 feet apart, socially distanced, safe, kind of like how we are here. So they did that. Well, they didn't do that, and they had to shut down right away. And yeah, so that's just something to kind of keep track of. And I understand, like in school, you want to kind of keep people under control. And even in the perfect world, assuming that you can keep children 12 and younger to listen to their teachers perfectly apart, outside of school, they're still going to want to play on the soccer field. They're still going to want to go to softball practice, tee off, and get that home run. But the only thing that you're really doing by bringing them in is exposing their teachers to their choices. So again, I just want to kind of make sure that we learn from our lessons, not only in Dane County, but also outside of Dane County. Thank you.
Thank you.
Thank you.
The other public comment we have is by email from the WTA leadership, although does this fall under the regular agenda where they have their report? Probably. Yeah, I think that should. So we'll read this under the report from the WTA. Other than that, that's our only public comments tonight. So right away we go to the teacher update, which is the WTA report. You all have a copy of this, but for the public, members of the Board of Education of the Waunakee Community School District. As representatives of the WTA, we thank you for again hearing our perspective as you engage in discussion and planning regarding the beginning of the school year. The instructional models determined at last week's special board meeting have provided educators with the direction in which we can move forward. Teachers have been attending school improvement meetings, curriculum planning, and participating in professional development so that no matter how we are welcoming students in the fall, we are prepared. However, we would be remiss if we did not share that unease and concern remain among many staff members as we face the reality of reopening school buildings in the coming weeks. At this point in time, only a few weeks before we open our doors to hundreds of students, COVID-19 cases remain high across the country, state, and region. And the CDC asserts that schools may be a driving factor of community transmission. We recognize the district's efforts to plan and prepare for how to minimize the impact of this pandemic on our schools and community. We also echo the need for feedback and guidance from members of the scientific and medical communities. While we appreciate the district's commitment to convening an advisory group, we assert that educational professionals must also be at the table as the district evaluates COVID-19 rates within our community and compliance to safety protocols. It is our sincere hope that this group will bring together a wide variety of voices with varying perspectives and expertise from both the medical and educational fields in order to establish clearly outlined thresholds at which we would need to re-examine and adjust our learning models. In addition to medical and educational guidance, an investment in the infrastructure of our buildings will be imperative to impeding the spread of infection. Air quality is of utmost importance, and an upgrade to the HVAC systems at our schools is an essential step in lowering the risk of COVID transmission. This safety concern has been brought to us by a number of staff members. We look forward to an in-depth discussion by the board about the steps that will be taken to improve our current HVAC systems, as well as an explanation of how these upgrades will demonstrably provide for increased safety before staff and students return to buildings. Additionally, we want to thank the board and our administrative staff for exploring the potential for district-provided child care for the children of our district staff members. When considering potential child care options, please keep in mind that the varying instructional models chosen for the district may result in an inequity in child care access for staff. For example, a secondary teacher may be provided with the flexibility to work from home. However, an elementary teacher who is part of the in-person model may not have the same opportunity. For this reason, we strongly advocate that staff be provided as much flexibility as possible when making decisions regarding child care arrangements, including the ability to telecommute to work when their job duties permit. For those unable to telecommute, we support a district-sponsored child care option for K-4 teachers, as well as 5+ specialists, such as special education and English learner teachers, so that these staff members are not put at a financial disadvantage. The district is one of the few in Dane County that will be inviting students into buildings in the near future. Though the circumstances are far from ideal, our staff will continue to dedicate time and expertise to support Waunakee students. We know the district is doing what it can to mitigate risk within the selected learning models. For the health and safety of all, we truly hope it is enough. Sincerely, WTA leadership. So that'll come to the teacher update. Next is board reports and action items. So board reports on any education-related events you may have done in the past 7 days.
I've been participating in the book study led by Rainey Biggs and Percy Brown, The White Racial Frame. Tomorrow night's our last meeting at 6, and it's been very enlightening and challenging, and will help me as we continue working towards the social justice equity issues that we're going to be working with in our district.
Any other? Next is discussion of an ad hoc medical committee. That was something that I've been bringing up. To let you know, David O'Connor is a doctor, research doctor at the UW, who has been working on a rapid test for asymptomatic individuals. In other words, it's a test he's been running with a group at a Fitchburg school, only doing the staff currently. They haven't been doing students. But the concept of the test is that you spit into a tube, so it's non-invasive. You run the test, and the results can be within minutes, depending on how you set up your testing. Testing is handled totally by the people who want the test. So you could actually have a nurse on staff can actually run the test after you have the sample. You don't have to send it anywhere. It's asymptomatic, so if no one even is showing any symptoms, you can run this as a screening test. And basically it's just going to tell you, it's non-diagnostic, so it's going to tell you if they have symptoms that could be COVID related. It doesn't tell you if you have COVID, but then you use the results of that test to then decide people who have to go get a COVID test. So the advantage is it's extremely fast. It's $5 a test, so it's inexpensive compared to a straight COVID test. And by that, you're doing a screening process to know when people need to get a COVID test, so you're not having to spend for the longer time and the more expensive COVID test. Turns out that one of his college friends happens to live and their kids attend Prairie School, so he got me in contact with them. I spoke with him this week. He's willing to help us if we want to go this route. It is a potential. The downside is it will have a cost if you start doing every student. You're talking $5 a test. The group he's doing now in Fitchburg, and he's actually doing it in Brazil, and he's doing it around the world, is running it twice a week. So you're talking $10 a student. You start trying to do that with 4,000 kids, you're starting to talk up a real dollar amount. Especially they do that every single week. But that's their way of getting to the result faster and not having to run a COVID test on everyone. Then there's the symptomatic test, which Randy has already had a speaking with Dr. Welt, I believe is her name. I did email her this week. She's willing to meet with us to help the school district set up rapid COVID testing. In other words, once you have a symptomatic person, you could actually run your COVID test faster and have the results just like the UW does there, where they have the results within 1 to 3 hours instead of having to wait 24 hours. So if you had someone who's symptomatic, or let's say you did the asymptomatic test, it said they were symptomatic, you then give them the full COVID test, you could go from somebody you didn't even know they had symptoms to having a result as to whether they have COVID or not within 1 to 3 hours. She is right now working on how resourcing for that would work, and she's going to get back to me either Wednesday, probably hopefully by Wednesday of this week. So that then brings us to the concept of having this committee get together. I've had interest from several people in the community who happen to be in the medical profession, who would help use some of their expertise in what they're doing at work to setting up what our procedures would be. How would you determine a person would need the COVID test? How would you determine whether a person would want the asymptomatic test? And how would you determine how you isolate them or not up until the point you get the testing done? Brian has volunteered to be another person from the board with that group. And then Randy, you mentioned having HR.
Probably want to have HR for some aspects of it, and probably student services and our nurses should be part of some of that as well.
Also later on in the board meeting, we'll be voting on our medical advisor. Obviously that person should be part of this. And the WTA has mentioned that they want to be involved, so we would of course contact them to get 1 or 2 people from there. So as this goes forward, I'll be trying to set dates once we get this together and have the resources to help making some of these guidelines.
Would we also be looking at, as a teacher group requested, making recommendations based on thresholds for staying with, or, I mean, I think we need to be clear what the charter is for this group. And I think that would be one of them too, so that there's this, I'd hate for us to bring the whole board back, emergency today, without that kind of a they'd have a recommendation that we can get together, but this gives a sounding board, I think, to a direction which is very appealing to me.
So you're talking about creating metrics for opening or closing in-person instruction.
Yep.
Right.
What I would add to that,
So,
Mark,
I mean, we talked November, this is our plan, but, so I'm assuming that things are as they are, and we go forward, but what's got to change for us not to go forward or even go beyond it?
and I think that's a good piece for them to look at. There are metrics supposedly coming out this week from the state and from the county
Okay.
to that exact effect, so that starts to help us to interpret some of those data
Right.
points, but I
Right.
think that would be helpful to be part of that as well.
And that was one of the original discussions I had with, is it Padov? was about those metrics. Hopefully Dane County will come out with that, but I don't think we can sit there and say, we're gonna wait until the last second and let them not show up with it.
Right.
Any other questions?
Can a third person be on that board or that committee?
Sure. We just can't have a majority again, obviously. You want
I'd
to?
like to participate.
As an ad hoc, it would be an open meeting, just like any other meeting like this. It'd be just like a committee meeting, so it would be
So do we need to move on that?
to establish it.
Okay.
Any other discussion? All those in favor of establishing the committee?
Well, we don't have a motion.
Oh,
Move to
we
establish
need-
the medical ad hoc committee.
There's a motion. There's a second. Any further discussion? All those in favor say aye.
Aye.
All those opposed? Thank you very much. And now, item 10, COVID-related updates, our favorite part of every board.
Yeah, the items that we have in front of you tonight, I know Brian will be joining us from HR in just a moment. The first three really revolve together with regards to some of our data that we're collecting as far as accommodations from staff, student registrations. Our remote work policy is the first item that we will be discussing when Brian arrives here in a moment. And then also, as the WTA had alluded to, conversation with regards to some of the accommodations that we are wanting to discuss with the board around child care. So the policy was an item that you had seen at a previous meeting where we brought the remote work policy forward. You did approve it. Brian, you can jump up there at the table. And what we're bringing back tonight is just including in a few of the pieces with regards to that policy and looking for your feedback with regards to the aspects that Brian has added in, I believe it's in bold at the bottom of the first page. So with that, Brian, I'll let you kind of talk about the impetus of it and what's bringing it back in front of the board tonight.
So this, again, is the follow-up to our discussion started 2 meetings ago. And then a topic came up at last meeting about the possible addition of a third COVID-related reason for allowing individuals to work remotely. And so, after conversation with Randy and feedback from the board, folded together 2 things into the document. Initially, the HR committee had 2 items move forward separately. The reasons for someone to access working remotely and the policy that they would work within. And so I folded those 2 items together by adding the first initial section in bold, which is, again, things that you've already stated you want us to pursue with employees is if they have an ADA-related accommodation. Secondly, if they live with a medically vulnerable family member. And then the third bullet is really the item that we had initially came up last meeting, and that is the idea that an employee who has childcare needs, if their position permitted it, we could explore remote work with them in order to hopefully prevent their need to request one of the FFCRA leaves, and hopefully keep them engaged with our classroom, our students in the classroom. The rest of the policy remains as you had approved, with the exception of the very last statement, which is feedback that the board had offered. I believe it was Dave. This is the idea that if we're going to have a written agreement for longer-term policies, longer-term remote work or telecommuting, we should do the same with shorter-term, and so just added that statement to make the 2 have the same requirements or same end document to work off.
Brian, I know I asked this at HR and brought it up last week. I still have a little concern about the minimum of 12 months of employment. With let's say we have a new teacher who has a child care situation. Do you see that working? The 12 months of employment before they can work at home?
You know, and I think part of the reason for that, and the idea is to have a good representative sample of someone's work before you start to give them and put them in a situation where they are much more independent. You know, you've got a chance to have them better understand our system, get feedback from within our system. You know, be observed, be coached, if you would. I think it does. You know, as you bring up, it doesn't mean that someone's new to us isn't going to have these needs, but this wouldn't be the avenue that we could try to support them in. The only, I guess the only thing that I would say for discussion reasons that would relate to it is that for purposes of the emergency family leave, which is one of the reasons why we're talking about this, is to hopefully prevent employees from going the route of taking those leaves. An employee has to work for you for 30 days before they can access emergency family leave. Emergency paid sick leave is immediately upon hire. Everyone has access to that. But if you talk about the care of your children, which is emergency family leave, you do have to work for us for 30 days to access that. And so if the board was uncomfortable with having to have someone work for us for a longer time, I would ask us to maybe have that as a potential alternative, is at least make sure that they're eligible for the family leave. But that wouldn't, again, provide you as much of an opportunity to get to know someone as an employee as certainly a full year would.
So Brian, just to understand, this is a policy that goes in forever, or is this a policy that we put together for just the COVID?
Well, it's a great question, Jack. So what I put in there within the reasons was some very COVID-related or pandemic-related language, but there's also some very general language that could exist and could go on into perpetuity. It could conceivably, for example, an FMLA situation, if someone had, let's say I broke my leg and was in traction, but I was otherwise of clear mind and the ability to work remotely, I could still, within this policy, do that, have some guidance as to what I would need to do or should do, and as a district, we'd have some guidance of what arrangements we would make, expectations we would have. But there, as with any policy, as the board, you can choose to amend, remove, or enact it at any point. But I tried to make it so the language would be both somewhat unique to pandemics, but also if we want to keep it in place for a longer period of time or other circumstances, it could exist for that reason too. And actually, as I look down, I would say another, probably even a more common thing that could happen is if we want, or if we have employees that could perform their duties at home during a snowstorm, that travel's not safe, but we want them to work, or they want to work and we have work for them to do. This gives us and them some guidance of how they could work if it was a situation like that, which would obviously be different, could come up anytime, conceivably.
Any further discussion? I believe we have a motion on the floor then for the policy. Well, we had a motion before from the previous meeting, so we should probably reaffirm it. Is there a motion to adopt the policy?
I move we accept the policy language.
Is there a second?
Second.
Any discussion? All those in favor say aye.
Aye.
All those opposed say no.
Nay.
And the motion is adopted. Next is data on student registration and staff accommodation.
Brian, I think you can stay there, but I was going to ask Steve to kind of walk through a few of these things, and you can help add in the details. What we wanted to do is bring back a little bit of data on where we're at with student registrations, some of the bus registrations, and then we'll also kind of overlay that with some of the information that Brian has with regards to staff accommodation requests, particularly as it leads into our next dialogue with regards to the board's interest in trying to do anything additionally to assist with child care leave pieces. But before we do that, I'd like Steve just to take a few minutes to go through some of the data that we've been able to collect up to this point, and please realize that it is still relatively fluid and changing, as we still have some folks to register and some pieces still have input we're receiving from staff and others.
So I'm going to be talking about this document that we handed out tonight. Does everybody have that? So you saw slides just like this during a previous board meeting when we were earlier on into the new online registration system. So these are updated as of Friday afternoon. Our district registrar, Julie Gangler, has been doing an amazing job working through all of these requests from parents. She had almost 200 requests that came in today that she was working through as well. So as Randy mentioned, this continues to be fluid, and parents continue to reach out with requests to modify what they had previously signed up for. There's two pieces of data on these slides. The first is registration, and what we just pulled out for you on the registration slide are students that are opting in for virtual learning, and that's broken down by grade level. So basically what you see here is the families that, even after the decision that was made by the board, and had an opportunity to email and request changes. So this includes requested changes that came in after last Monday's board meeting, as well as what people had put in before. We are seeing significant interest in virtual learning across all grade levels. So if you look at kindergarten as an example, there's 84 students who have opted in for virtual learning, and using our typical class sizes, that would be 4 sections of kindergarten students that would need to be assigned to virtual learning. Our next steps in the process for this registration is to close off for parents for a temporary period of time the ability to make additional changes, because we now need to move the virtual selected students out of the in-person students. We then need to assign in-person students in grades K through 4 to AM or PM, and then we need to communicate that out. So that's our shorter term goal, and in order for Julie to be able to switch her attention over to that, we have to close off the process of changes and input from parents. And again, that was due last Thursday, so she's continued to work on that. And that will allow her to shift her attention to really the next steps in this process, which is going to definitely take us a period of time. So that's where we're at with the registration piece. A tremendous amount of work has gone into this so far, and there's a significant amount of work that needs to be continued moving forward with the registration piece. The next piece of information is regarding food or transportation. Our transportation numbers remain very low. Certainly, this is an area that we have requested publicly through these board meetings for parent assistance. We indicated to parents that it would be challenging for us to operate our traditional transportation system without some assistance with transporting students to and from school, and our parents have definitely responded. You can see from this information that we're running a little over 11% of the student population is requesting transportation to school. So those are very, very low numbers for us to see that. That's going to make the transportation system much more manageable for us to operate. It's going to allow us to operate a system where we can feel much more confident about the capacity on those buses and our ability to serve the families who are opting in for transportation. Some of the next steps for transportation is we can't plan much further until we have gone back to the student registration and have worked out the AM/PM piece, because we're going to have to be able to have lamers understand which students are in which session. We have to notify families so that families who are interested in putting in requests for alternate transportation have an opportunity to do that. Our transportation policies do allow families to request, as an example, to go to a child care facility like Adventures in Learning after their day is done. We expect that there will be interest in that as well for the centers that are accepting students. So the transportation next steps really are connected to the registration next steps. We are going to be communicating with our families as soon as we can, but each of these steps takes time and we have to work through them. And we're going to be doing the best we can to get this information out to our families so that they can see what this picture is looking like. But definitely the takeaway is strong interest in virtual registration and low sign-ups on transportation as of right now. Any questions at all on what we're seeing?
How close is this 3,800 registration to what we expect?
That's a great question. How close is the 3,800 to what we'd be expecting? Our projection was a little over 4,300 students. So in speaking with Julie today, there certainly are families we've not heard from at all. So we don't know if they're interested in virtual. We don't know if they're interested in the hybrid AM/PM. By default, we're going to be assigning the students in the K-4 to in-person learning if we have not heard, because we want to save them a spot. And then if we do hear from the parent that they're looking for virtual instead, we can remove them. But we do want to make sure we're, for the families we've not heard from, that their students have a place with in-person learning. But we did have another 200 emails that Julie was working through today, so we're certainly getting closer. But there is a segment of our families that we've not heard from.
But so no indication they're going somewhere else?
No indication at this point.
Do we have any indications from anyone that they are planning on not coming back, like people who are asking for alternative waivers and whatnot for open enrollment?
So we are not seeing a significant increase in open enrollment activity. I think a main reason for that is the DPI put out information last week reminding every district that they are bound to the decision that their boards made in January, and that school reopening plans around COVID-19 do not change the capacity numbers that a board approved back in January. So in our case, we did approve a number of openings in certain elementary grades, but if as many families opt for virtual, you would look at that and say, well, maybe we now do have capacity inside the buildings, but our decision in January is a decision that we have to follow, even if it would turn out that space would be available, and all school boards are bound by that. We have had some inquiries actually from districts who have selected all virtual about enrolling here in the K-4 program. We haven't had a lot of space available in K-4, but there has been some interest. Not seeing a lot of interest open enrolling out. So the open enrollment, I would say it's been generally quiet on the open enrollment front. We're not seeing, I would say, significantly different activity compared to a standard year.
What I would add to that, Mike, is like if a student or a family chose to go to a private school, for example, they may or may not contact us and let us know that they're doing that. We usually would find out once they're accepted and they would request records. So that would be kind of what would precipitate that, unless the parent actually told us that they straight up that that's what they were doing. We've had some of those conversations anecdotally that we know that there are some folks who've chosen that, but as far as trying to quantify it, I won't know that until some of them are actually enrolled and then they request the records that will precipitate that. And that's part of the challenge with just trying to narrow down all the numbers, is that there's a lot of variables that are still out there that are being vetted out.
On this sheet, the 5 through 12th grade, wanting virtual, they're the ones that in November, they want, when hybrid is open, they still want to stay virtual. Is that, am I reading that right?
Yeah, so the question is, when you look at the 5 through 12 and the signups for the virtual, our communication out has been designed around, make your decision for the virtual for what it is that you were looking to do. So yes, those families were looking at that from the virtual education perspective past when we would be bringing students in. But it certainly is possible that, there could be some of these numbers where parents might say that they were intending to change or they didn't click the way they thought they were going to click. So we do know there's going to have to be another process of allowing someone to reach back out and say, that's not what I thought I had signed up for, or not what I did. But Randy and I were talking about the 5th to 12th grade today as an example, because in 5th and 6th grade, even though we are starting with virtual learning, we do have to pull those students out and put them in basically a remote learning school. Otherwise, they would be assigned to in-person teachers who would be assigned to the students when they come back potentially in early November. So we do have to pull all these students out of our in-person system to be able to assign them to virtual teachers, with the understanding, to your point, that this would go beyond November when we would potentially be bringing students in.
How many bus students are we providing to St. John's? Is that going to affect our numbers on the 15 per bus?
So for St. John's, what we have done for St. John's transportation in the past is the students have been picked up on the normal, let's say, Southbridge route, brought to Arboretum, all collected together, and then basically riding a shuttle run from Arboretum to St. John's. We are also going to have to be looking at the capacity numbers for St. John's, because we do not want a shuttle with more students on it than we can really socially distance seats on. But our understanding is that at St. John's as well, they are also looking at this, and our bus company's been connecting with them. The number of requests for transportation are low at St. John's as well. And so we're expecting just all across the board to have just less interest in transportation from district-provided school buses.
Brian, do you have any further updates with regards to like accommodation requests, the numbers? What we're trying to get a handle on is kind of the scope of all the different variables that we're working with. Ms. G was able to give us an idea of the kids in person and virtual. And then obviously a corollary piece is then working with our staff and some of the policy pieces we just approved that'll give you some latitude with childcare. But certainly, what are some of the numbers that you can share with the board and the community, really where we're at with numerically accommodation requests?
Sure. This has been a real major focus of what I've been doing over the past 2 weeks. A lot of communication with staff and across employee groups as they kind of inquire and they ask about what their options are and what the realities of work are depending on what their position is. I will start by saying that my hope is that any numbers that I could share would always be more firmly established than much of the information that I'm able to share with you now. But I think the fluid nature of what people are working through, I can give you good indications of where people are right now, but I do have to acknowledge that this could change. What someone indicates now could change based on their personal circumstances, their family circumstances, their child's daycare or school circumstances. There's a lot of variables involved, and it's challenging for everyone to give a firm answer that they're going to stick with. Preliminarily, though, I do have, right now at this point, 17 individuals that have sought out accommodations or modifications, either for their own vulnerability, medical vulnerability, or someone that lives in their home. I've had 61 staff contacts with individuals that are talking about childcare, and the nature of our conversations within childcare it was option based, and some of the clarity that was provided tonight within the first policy is part of what that discussion has been about, which is the potential to look at remote work for some individuals. But also, as we move deeper into the agenda, the other topic is childcare placement, and that's something that's going to come up after this point. But certainly been trying to gather from staff their sense of, with really those parameters. They have the backdrop of the federal leaves that are offered to them and that they can elect to take. And the way the language reads, they can elect to take and notify us as their need develops. And so that means, and as I mentioned before, things can be fluid. They might have something established and that changes. And they might have a child care center that's closed. They could have an individual set up to watch their children who changes their mind. And so there is some variance there, but this is the FFCRA, or the Family First Corona Response Act, is very employee friendly in that regard. But with staff sharing that with me, where we're at this moment is that I have had 6 staff indicate that they will start the school year on leave, because that's where their family needs are at. I had, again, this is not all 61. I did not gather feedback. I did not get feedback from all 61. I requested feedback from all 61 via a survey. I got a response from 51 of those individuals back. So there is an unknown there. I can't say why they didn't answer or how they couldn't answer. But
Ryan, can you help me understand what this 61 is? There's
Sure.
61
staff members
requested because of their situation. They need some type of family leave.
that childcare is a need that they're exploring or experiencing. So those 61 individuals are solely, those discussions are solely centered on childcare.
Okay, and then 17 of the 17 number is everybody else.
Those 17 individuals are separate from that 61. So again, it's 9 individuals were seeking an accommodation for themselves. 8 individuals had a vulnerable family member in their home. And then 61 folks wanted to talk about their need to provide care for their children or find someone to care for their children. Staff had indicated that if there was no child care options provided by the district, and that can, when I say options, we talked about the flexibility to look at virtual or remote work. And I would say that not every individual that is interested in remote work will qualify for remote work because some positions are required to be with students. And in that regard, yes, Mark?
I'm sorry, so the 61,
Yep.
is there teaching staff or that's all staff?
It's teaching staff. Actually, it's the majority are teaching staff. There's a small percentage of paraeducators, and then there's, I would say, some other positions, whether they, in other classifications.
Okay.
But the majority would be teachers by far. And so again, so as I was saying, not everyone that is going to want remote work will be able to qualify because of the nature of what their work is. And so that is really now that after the board's motion within the policy, before that, those discussions are going to begin with the building administrators and directors tomorrow morning. We've got a meeting number 1 kicks off at 9 a.m. as we start to look at who these individuals are that have requested it, and we start to review what their roles are and whether they're able to be accommodated virtually. Which relates a lot to what Steve had brought up with we get the picture from students who wants to be virtual, and then we try to pair those two groups up, knowing that it's pretty unlikely that it'll be a clean need and supply, but we'll see where we get after the initial steps of it. I would say, the folks that gave us feedback or have provided feedback, 13 of those individuals have said their number 1 want from the district is child care services. That's 29 kids, 29 school-age students. The one that the staff that have indicated that what they really prefer as their number 1 option would be remote work. Would be 17 staff, and that's 19 school-age children. And then of that mix, of those 30 individuals, 25 said they could go either way, right? You give me one option, give me the other. If I can make one work, it might prevent me from taking the other. Right now, again, with the staff that have provided me this information, I have a number right now that would say the 29 students would be the initial number of students that staff would be looking for child care options for placement. And the maximum that could be based on who's giving me feedback would be 48 children, school-age children.
So really what we're trying to do with this providing free daycare for our staff is to minimize the FMLA.
That's exactly
So what we do is we minimize the FMLA, and then we have a benefit that's into perpetuity.
Well, I guess in the conversations that I've had with staff, I did not, I've never expressed or believed that we were talking for anything more than the current situation. And so my conversations have focused on this school year, not going into the future for that option. But absolutely, Jack, the whole reason for bringing up the flexibility to look at remote work and the possibility of providing daycare is to keep staff from electing to take the FFCRA leaves, so that we can look to avoid the staffing needs that will produce, and look to keep as many of our staff engaged working with our students as we can.
So just trying to be clear, you said there's 17 staff requesting remote.
That would be their first option, yes. Okay, yep.
So, and then there were roughly 40 school-age children that the staff has requested childcare access with.
Yeah, that would, at this point, folks that have said, and the survey asked them, what are the, names, ages, and what school do your students go to? Because that's the information that we have to gather as part of the act. What they provided me is right now, the staff that responded to the survey have given me 48 of their children's names and dates, and et cetera.
And then that breaks down with regards to a preference as well. As you mentioned,
Yeah.
29 had the preference of childcare.
Yeah.
The others could go either way.
Right. Yeah, they could go. Some could go either way.
Right.
Some identified that some have identified that placement childcare is their number one. Right. They either they don't feel they can deliver remote, or they don't believe that their position. They don't believe that their position would be able to be remote. That I can't get in. I can't get into why somebody said placement over remote. I just asked them which would be their preference.
I think to your point, Jack, and I didn't hear everything you said, but part of what we've been talking about is you kind of transition into the next kind of agenda item here and talking about childcare pieces. That was a conversation we've had at the board table now the last few meetings with regards to one, use of facilities by a group such as Wisconsin Youth Company. We've worked with them because we know that we have a need community-wise. We also know, as you're hearing from Brian, we have a need staff-wise for spaces for child care for families and children. So we wanted to see what's their capacity. So they've articulated in their proposal, and this is with regards to any children, not just designated, is that they can host 10 locations. So 10 locations means 10 classrooms with a max of 15 per classroom. So that's the first piece. And then the piece that relates to the conversation we're having is how do we need some tools to work with staff to be able to keep our staff in front of our kids and to work with some of the accommodations that we feel we need. You gave us a huge one with the policy. And that gave us one mechanism to do that we didn't have prior to tonight. But I think it's also the piece we wanted to have a conversation with regards to the child care pieces. And within your board book, I just allocated out really 3 different options here. One is being able to allocate a certain number of those, potentially for staff, so that they can start to utilize them and access them for some of their needs, thereby allowing them to maintain and being able to teach in person or the work that they need to do. That could be done in a couple of different ways. It could be done with no funding from the district to help offset that, and that would totally, completely fall on the staff member to pay for. And then the third option is some sort of child care option that we either in part or in whole help to subsidize for some of those that went through the process with Brian. I mean, we can't open up child care for every single employee, but we need to be looking at those places where accommodations may be needed in order to keep a program or a staff member in place. And looking at those specific areas as far as are there amenabilities within any of those 3 options that the board would like us to explore. I've attached to you the Wisconsin Youth Company's proposal. They can kind of give you an idea of what they're actually looking at. But from our perspective, we know that if a staff member takes the leave that's about a $12,000 cost. That's the cost of the long-term sub for the period of that time that they'd be gone. So we know we incur costs on that end of it. It's a matter now of how can we help to mitigate that through other accommodations. Some have a cost, some don't. The policy piece you just provided us gives us some latitude to work with our staff that we didn't have before tonight. This is the other option. It also just gives you a picture of how many kids the youth company can help to support internally. I do know, just as an aside, that there are potentially some groups, existing preschool daycares that potentially may look at expansion as they know that there's a need. Some of that's limited on space, but I know that there's some exploration of spaces around the community. So that's kind of the backdrop of that I think kind of leads into the combining of what Steve reported on students and Brian with regards to staff. So looking for kind of the board's feedback on, it's a pretty big item here, but wanting to see kind of the direction that you'd like us administratively to kind of pursue. But from our purview, those are the kind of the options that would be laid out in front of you.
Randy, I think one of the things that you said is you can't provide child care for everybody.
Right.
But how do you distinguish? You know,
Right.
that you deserve it, you don't.
Right.
You know, I think it opens up a can of worms. I think if it sounds like the child care issue is where does my kid go? It's not where does my kid go and you pay for it.
Mm-hmm.
So if you could potentially, in my mind, you know, put together a program where it's, you know, teacher, you know, you provide the platform, the
Right.
teacher pays for it, because, you know, we've got a whole community here where we
Right.
made decisions where we're going to go virtual, and we've got a lot of parents hurting because of that. So I guess, you know, if we have to put together accommodations so that at least they know where their kid is, I can live with that.
Mark?
Can I back up for a second? So Jack, I just want to reiterate what I think I heard you say, was that if there was, so under kind of the proposal piece here, you're looking at, if we could create some spots that would be designated towards staff so that they could know where their kids are, but from your perspective, there shouldn't be a district contribution towards that cost. That would just be an opportunity for them to place them.
That's right.
All right, that's
Otherwise,
what-
it's another benefit.
And I see some, the merits for that, but I also see that no matter what platform we're using, this is going to be an issue. And we're trying to provide the best education we can with our best resources, which are the teachers we have working for us right now, not a substitute. And I would argue that if we use a dollar amount comparable to what the Wisconsin Youth Company is projecting as a guideline, I think we should avail that expense to any staff who need it.
I would agree with Mark. I feel we need to keep our staff in the classrooms teaching. When I look at these numbers of possibly 29 people, how can we possibly provide subs? What type of subs would we get? And it would cost us $12,000 a person in addition to not having the best teacher in the classroom. I feel we should set some type of contribution to staff members to help them. This is not something that I would do in a normal year, but I feel we're asking them, we're giving them a choice, and I would like to provide whatever we can to keep them in the classroom. They're our best resource.
So would this be only offered to teachers who are in the classroom?
Oh, no, because our virtual teachers might have the same need, depending upon, we're asking them to, take care of their kids and move them along in whatever platform they care.
I would
When you say
clarify
virtual
that.
teachers, the virtual teachers are in the classroom, aren't they?
Well, with the
Unless there's some
accommodation,
Unless the.
they could possibly now be at home. Initially, we had said yes in the classroom, so there might be some flexibility there.
Would it make sense, though, the accommodation you just added was for childcare? If we're covering the childcare, they wouldn't need the childcare accommodation then, correct?
That would be,
I'm just trying.
that would certainly be a big, a large segment of that group, Dave. They had expressed that their preference would be to be with their own, to work remotely so that they could do their own childcare. And that was, that was 17 individuals said, I would prefer to be working remotely with my own kids, taking care of my own children. And then right now we have 13 that are on the other side of the spectrum that have said, I want placement for my children somewhere so that I can work on site.
So you've got a mix.
Oh, absolutely. There's a spectrum, and certainly there's some overlap between the only thing I will add is that, and just remind everyone is we can provide these options and we can put these things in place. It does not change an employee's opportunity to choose to take leave. It hopefully convinces them otherwise, but it doesn't change their rights to a leave.
So based on the scenarios we're kind of looking at, if we provided a location, you're thinking the number, it sounded like the highest number was around the upper 30s of number of children that would need that type of care, correct?
Based on if the staff who responded to my survey, all of them said, now where I land is I want placement for all my kids. The most we had was 48, but I can already tell you that includes, there's 19 kids that their parents don't want them placed. So I guess you're right. Thank you. Let me talk myself out of it.
Right around 30.
So 48 minus 19.
39, 29.
Yeah, 29.
Okay, so if I'm looking at this correctly, and we're looking at about $200 for a week for one child, it was like $215, but maybe a few of them fall into our AM/PM group, but probably most of them are going to fall into that full day because they're either children not from our school district or they're above 4th grade. So odds are we're looking at 200 times 30 is $6,000 a week. How many weeks are we looking at? 18?
36.
36 school years.
So by the time we take 6,000 times 36, that would be our total cost, which puts us at $200,000. So when we're considering all this, that is basically probably our upper limit, is around the $200,000 mark for funding this program. And then, of course, that can be a mix of staff versus the school district funding. But the cost of how many teachers do we think this would help?
If again, before we had the opportunity to offer any virtual work, there were 19 staff that said we're definitely taking a FCRA leave. This is in addition to the ones that are going to start.
Right.
We had 19, so that cost actually of sub-cost was $232,699.46.
Okay, I came up with 220, but same difference. About $230,000, which is almost a break even for what the child care would cost. Assuming every single one of them decides to do it. and assuming we end up with 30 kids at roughly 200. My other one structural question is, they need 10 classrooms for this program, they're saying, based on the model they gave. Where are we doing that?
I think you could have an option of some of the rooms at Heritage, and there are some rooms that, they had kind of framed it up in here as Heritage. I think we have rooms at each one of our buildings that we could create space.
Would it be trying to do it at the elementary schools, since that's where
Primarily.
probably our primary number of teachers who need this assistance would be, so at least their child would be in the same building?
Primarily the elementary school and potentially at the intermediate schools in Peace. When they use the intermediate center, they're actually referencing Heritage. It's just the rooms they use.
Structurally, we wouldn't have a transitional problem. Well, it wouldn't be there for the second quarter, but the 5-6 could be an issue.
The issue with childcare is regardless of model.
Right, no, I'm just wondering, space-wise, is,
Right.
we still would, you think we have enough space in-house, and if we did, we could try to
Because we're
find
not
some.
creating any satellite classrooms in any of our models right now, we're utilizing the same room. So it shouldn't change any classroom configuration. Space-wise isn't an issue with this plan with regards
That's what I wanted.
to, like, and that's for any of the childcare.
Well, actually,
so
the
Randy-
model required one room for sick children, so you'd have to have it at every building, or you have to have it all in the same building.
Right.
Plus their supervisory staff and their excess staff for doing medical all have to be at the same location. Otherwise, I mean, I don't think we can remote the people who do that, you know. So in a weird way, we kind of have to have them at the same location.
And I think that.
Randy, I got a question here. If teachers don't feel comfortable coming back to school, and then we open up 2 classrooms so we can bring their kids into school,
Right.
you know, it seems hypocritical to me that they feel this is a safe environment for their kids.
Say that one more time, I'm sorry.
Teachers don't think the buildings are safe to go into. Those are the emails I'm reading. And we can't open up school because the buildings aren't safe. Now we're sitting down and we're saying, we're gonna put 2 or 3 classrooms aside for their kids to come in an unsafe environment. It doesn't,
I think
It
the
doesn't
folks-
jive with me.
I think the staff that are looking to, who are reaching out to Brian for some of the on-site childcare assistance are looking at it so that they can teach from the classroom or they can teach in person. So I think is that accurate, Brian?
Yeah, yes. There are staff that have expressed exactly what you did, Jack,
Yeah.
but they are, they would tend to be those that said that they're gonna start with a leave, or if they don't get remote, they're gonna go to a leave. Because in the communications I've received, staff have shared exactly what you did. If they don't feel it's safe, they don't want to put their kids into a group setting, which is certainly a segment of our staff, but it's not all of our staff. I mean, certainly staff have expressed fear, concern, but there are also staff that have expressed interest and excitement to be back. And so I have heard from all parts of that spectrum. I cannot say that it would be accurate based on what I've got for communications that all of the staff feel the same way. There is certainly a spectrum of those feelings, but it is across the group.
I mean, to me, Jack, this has to be part of the accommodation process as you kind of work through it with each of the individuals. And that what we're trying to work on is how do we have some leverage to be able to keep our staff in place working with our kids and also not opening this up so wide that it's just for folks who don't need it as a barrier to come back. That's the piece that I think we're trying to figure out is what are some of those options. And that was the policy, and then that's the childcare. Whichever option within the childcare provides, even if it's just allocating spaces at a very bare minimum, that provides options. If we look at some of the other cost pieces, if they take the leave, we have a cost immediately. We know what that is. So that's the piece that we just shared that so we can have that dialogue around it.
So, 2 points. One, I'm assuming, if we agree to this, that voucher for childcare, whatever we want to call it, that benefit could apply whether they're using the Wisconsin youth model or choose to have their child going to a daycare where they've already been attending.
Because I hadn't talked about it. I wasn't looking at it as a voucher.
Okay.
In my
Or whatever,
mind, it
the
was
fees or
trying
expense.
to create an option that we could create.
Right. So wherever they send their kid, they could.
Yeah,
whatever
I think
cover.
it gets into a, I wasn't envisioning a voucher type program
Oh,
like
okay,
that.
okay. And then, again, in terms of the whole concept, I just think we're trying to provide the resources so our teachers can be the best teachers they can be. And we're trying to provide resources for our families to have in-person options. And all that comes with a cost. And to me, this is no different than looking at HVAC expense or
Exactly.
looking at water dispensers. This is a cost to the business in this environment. And I think we owe it to our staff and our students to provide this resource.
Especially since the whole community has time and again praised the teachers and needing our kids to be back with their teachers. That's the whole purpose of, when we wanted to go virtual, people really wanted the contact with their teachers, and I think we need to accommodate that.
I'm just saying, try to explain that to the parents that are trying to figure out their child care needs as well. I think, you talk about stress.
Right.
Our parents are stressed as well.
Right, no, I 100% agree with you, Jack. The optics of paying for child care for staff when parents all over the district are concerned about child care. They're worried about whether or not their wraparound child care after school is going to kick them out and not take them anymore because they're going to school, which is something that some child care facilities in the area have been threatening. So for us to then say we are going to pay for children of non-students to be in the schools can be a bad one. But that being said, you do have teachers who actively want to be in the building and teaching. I mean, we all got an email from a teacher today. Well, she didn't sign the statement saying it's not safe to be in the school, but she wants to be there, but she's got a 6-year-old and an 8-year-old. We have kids that are in intermediate school who are going to be virtual, and they're not old enough to be left home alone all the time either. And their parent wants to be in school, and we'll be teaching kids in school. But if we don't have some option, I mean, I agree it's a bad option, but it's the only option we have to make sure that those quality teachers are with us. So I don't like it any more than you do, but I get the sense that we don't really have any other choice. And we all talk about valuing our staff, and how else can we value by saying that we understand their needs? Not to say the community doesn't have those needs too, but we can do something about what our teachers need. And not just teachers, other staff too.
I gotta say, that this is a horrible option. I don't see a great way on how to do it in a way that's fair to everyone. It's just like the whole decision about being in person or all virtual. There is no one option that's gonna fit everyone. But we have to sit there and try to find the one that keeps our programs going as well as possible, and the one that does it as safely as possible. I think we should subsidize it. I'm a little more hesitant to say we pay the whole fee. Only because I also, how to say this? There's no good way to say this. I don't want it to also become, well, I got free childcare. I really didn't have a problem, or I had a version, but then this was free, so I did it. I want it to be for the people who really need it. But there's no good needs testing for this. There's no way to say who needs it more than someone else. If we make it totally free, I'm worried it'll get flooded. If we make it too expensive, that's just it's gonna cause too many teachers to go to the FMLA, and that'll hurt us worse. So there's, unfortunately, I'm doing how to get down on middle ground again. I see a $200,000 bill that either we bear or the staff bears, and either way it hurts. So I'm saying we should at least pay 50%, maybe higher. Otherwise, it's too much of a burden or it's too easy. Now, if these AM, PM pods probably aren't going to affect our staff as much. Not all of our staff's kids are in our district. They'll use it a little bit, but we are creating, 45, 90 slots for parents who have an issue that need that wraparound care. As part of this program, we're creating that too. And I would, looking at that dollar amount, and I haven't had my child in child care for a long time, but I remember it was really in that $200 range. So if it's at 170, it's probably less than most of the child care around the area. And it's very easy to do because it's going to be sitting right at the school. So I think the program's a great idea, and I do think we need to subsidize the rate to some degree to make it affordable, but not to make it such a burden on the school district also, but to try to help encourage the teachers that need it, that they can get it, but only if they really need it, I hope, so that it's available for those who do.
So are you proposing that the fee, we pick up 50% of the fee? Is that your proposal?
Does somebody have a better number?
I'd
Well,
like to
Feel or
pick up.
something?
I'd like to pick up
I like the
100%.
idea. The number here is probably conservative to what someone's going to have to pay to a non-sited daycare. And so this would be probably less than most of the daycares would require for a week's coverage. And that's why I feel this number is probably representative. It's a very conservative number that they're offering us. But if you're sending your children already to a pre-existing daycare where they provide the service, 200 is not going to cover it. They're going to be paying out of pocket for that too. And so, to me, this would be a nice middle ground.
So are you
Well, what's
suggesting
your-
that teachers pay $200?
That we use, that we provide this number that Waunakee Youth Company is offering for every teacher, for every child that needs daycare. And what isn't covered by that, then comes out of their pocket.
So you're saying we cover the 100% of this program?
Provide this number to any staff member.
For
And
any
then if
staff
they come
member.
here, 100% is covered. If they go somewhere else, it may be 50% will be covered.
Is your proposal, Mark, to be within the accommodation process that Brian's implementing?
Yes, yes.
All right, go ahead, Brian.
For information's sake, I could not give you a good number of how many of our staff have children in daycare. What was communicated to them was they have an unmet daycare need, and that what I had shared with them is that we're gathering information about who has unmet needs and understanding that there could be limited capacity, there likely would be limited capacity, and I was only looking to gather information from those that did not have coverage, because if everyone applied, it's likely that those that needed it and had no other option would get left out. And that was what I had communicated to them. So the numbers I'm talking about were phrased very differently when I asked people for that information, besides, do you have kids in daycare? I don't know that number, and frankly, I have no idea how that would be different from what I've shared with you.
So I guess at some point we need a motion.
I make the motion that the school district pick up 50% of the fee. Teachers pick up the others, because I agree, I think they have daycare already that they're paying for. I think we can be flexible, talk about being flexible, and I think if we're all in this together, then, you know, the taxpayers are picking up some, the teachers are picking up some.
So your motion is support for this program, and any of our staff that use it, we would pick up 50%.
For this program.
For this
only?
program.
For this program.
Is there a second?
I'll second
Okay, so now we can have discussion on it or amendments or whatever you want to do.
I guess my only question is this something that's going to be defined as exclusive, only available to staff members in the district?
There's
It has
gonna be, you mean the program piece?
Yes.
No, it would be, so let's just use the example of the 49 kids or whatever. The rest of those would be opened up to the general public.
No, what I mean is there any ability for the public to also be involved in this childcare option, or is the childcare option only available to district staff?
Yeah, so district staff goes as much of it as they need. After that, it's open to the general public.
Yeah, this is our
And they
general.
have to pay for
Yes.
it directly?
Yes.
Okay.
Yes.
Thank
So
you.
this is our general, think of it, this is our after-school program we normally offer. That's the company that does it. Given just how we work with them and utilizing their pieces, we've had conversations of what could they do under these circumstances. So this is their max they're able to accommodate us. And then as we've worked through the HR pieces, we've brought that piece just to layer on here as conversation. So that's kind of, but if there's additional spaces, there would absolutely be pieces within this that would be open to the public.
Mark?
So, a point of clarification, with Jack's proposal, if I live in McFarland or DeForest, and because I know I'm coming back in some form, I needed to make sure I had childcare to cover my kids because they're stay-at-home kids. I would not have access to half of this. It'd have to be to this or nothing. Is that the motion?
So
Or do I get 50% of this number to apply towards my childcare for my kids in the farm or the farm?
No,
No, it's to this program.
it's this program.
It's
We're
not, it's
providing-
not dollars to go to travel. It's for those folks who need it in order as their
Well, I
accommodation.
know, but so my question then, and my concern then is, 2 weeks ago, I had to commit to childcare for school coverage. And I have no access to this benefit that other staff who are still on the fence have. So, for me to vote on this, it'd have to be something any staff member who has to get childcare to stay working should have access to, not just to Wisconsin Youth Company.
I can't even begin to imagine how much that dollar bill you're creating is.
But it's the same, so if I didn't do it and I'm a McFarland, now I can join Youth Company because there's this option. I didn't have any other option, I couldn't find one yet. But if I did find someone, because I knew I had to come back, then I don't qualify because I had to guarantee my kids had a place for learning.
I understand what you're saying for equity, but we have to be able to put a dollar figure to that to budget it. And I don't think we have any guess as to where that would be. And then if you're talking 50% of going to a Montessori school all day.
No, 50% of this number, not 50% of what.
Oh, so you're saying you would give
If this is, if we're giving
$150,
$110.
$110 credit to any staff who had a kid in childcare.
We had to put a kid
anywhere.
on staff to come to school to teach, so they could come to teach. I don't know why that shouldn't be available to anyone.
So you're saying, so let me clarify it again. So staff member still has to go through the process through Brian's office for the
Yes.
accommodation. They qualify for the accommodation. You're saying that basically they can attend this program where we're going to contribute half of that, or if they've already secured childcare and they're closer to their home, that they could have the equivalent piece to that.
Yes. Yep.
No, so it would still be through the accommodation process. It would still be the same number of people impacted. It would still be the same cost. the benefit of that is it would open up more spaces internally here in the community for other people. That's how I'm reading what you're saying.
Yes,
But they still, I guess the piece that I think that may
but it still
help
has to
some
be
of
part of
us
the accommodation.
is, Brian, when you go through like the accommodation process for childcare being kind of that accommodation piece, we have to discern it down to those who, that this is the trigger from returning or not able to return. Is that right?
That was what they were asked.
Right.
Yes.
And so that's what this is built on.
So are we saying we would limit it to the people who have already answered that question? In other words, if another staff member comes in, hey, I have the same issue and I found something, yes, but I have to have that in order to be able to teach, you should give me that credit. And Mark, you're saying, yes, they should get that credit.
Yes.
I don't see where there would be any testing then such that every single teacher could make that same claim and we would pay it on every single teacher.
Yeah, my
Correct?
concern is numbers. We don't have a solid number to go
We
off of.
do not have a solid number.
We're sitting here hardly talking about how many staff? Not even 30? We're talking about hardly 30 and we're looking at a over $100,000 bill. We have over 300 staff that I would guess at least half of them have children that probably have some child care area. Yes, but the thing is, you're paying it per child even. So if one of them had 2 or 3, you're paying them $330. This number could easily hit, I don't see where it couldn't hit $1 million.
Isn't this just with people that have applied for this accommodation?
This is just those that reached out. And then what I talked about was limited capacity. I pointed that out, there's limited capacity. If we exceed capacity, it's foreseeable that there would be some sort of a priority system set up within it. And so, as best I could, through the phrasing of the questions, I tried to get it across to staff that if you have other arrangements, this is hopefully not the one you're looking for. This is for those that couldn't find something else, something else fell through, what have you. And again, it is school-aged only. That's what Wisconsin Youth Company works with, is students that are in kindergarten through, this would be potentially through age 14, but
What about special needs? And if you get a special needs kid, how do you handle that?
The special needs students or children would be eligible for leave up to age 18. I would say that I can't speak to exactly how Wisconsin Youth Company would work with a student with special needs. We were more focused on the age range as opposed to the other aspects of a child.
They're a licensed child care provider, and I believe that they can go, they're really age bracketed between, I think, kindergarten to like 14 years.
Well, I think just to maintain where we're at, currently we have a motion for 50% for this program only. If you want to make an amendment to open it up, you can.
Brian, so this is for K through 6, correct? Wisconsin Youth? We focused on age. Our discussions were focused on age, but Wisconsin Youth Company does focus K-6 within our district, because this is an existing company that works in this is our aftercare program in previous years. This would be an extension of that. So typically, and I would say my conversations with staff members and the data that I gathered from staff members, they're following that, 12 cap it at 12-ish would be where most folks would be. I think that, I guess I'd be conjecture if I talked about why they weren't putting 13, 14-year-olds, but in general, what folks were reaching out to me about was up to about 12, school age up to about 12 years old. Okay, so I'd like to amend Jack's proposal to provide the same dollar value, 50% of that $215 or $170 to any of our teachers with kids K-6 who needed to find daycare in order to teach, and they would have to follow the same procedure as applying for the accommodation.
Is there a second to that motion?
Are you motioning that they provide all? Or still, are you at 50% or all now?
50% of this fee, this charge. So we're saying, Jack's proposal is that we pay half of the $215. And that's the dollar value. I would say we would go to someone if they choose some other source other than Wisconsin Youth Company.
Is there a second to that motion?
I'll second it.
Okay, there's a second to the amendment. We're only discussing the amendment, and the vote we would hold afterwards is only on that amendment. And then the main motion would be considered depending on if it's amended or not. So, discussion on just opening it up to beyond this youth company program.
You can make one more amendment, correct?
Yes, you can. You can make up to 2 amendments.
I'd move to amend Mark's amendment motion that it can only be provided to licensed child care providers.
Okay, so now we're talking about that it can only be applied to licensed child care providers.
That would have been my time, I can say.
Is there any discussion on, oh, you need a second to the amendment of only licensed child care providers?
I'd second that.
Okay, so now we're discussing just saying that it's restricted to licensed child care providers. Any discussion?
I wasn't just going to try to get a double amendment in there. I just thought it was prudent because if you give a credit,
Oh,
I
you're
mean,
right.
hey, when before we talked about doing anything with my kids, we talked about running Grandparent Academy, and hey, I'd love to be able to pay my in-laws $110 a week. Don't want that. It should be that someplace it's appropriate. That's all.
If I could clarify one piece, one of the things I think that Jack had said was half, you had kind of used the number 215. There's actually a number that we would work with them on. It's under the paragraph of subsidized for essential staff. They didn't quote that, but it's anticipated it's less than that. So I think it's whatever. If you're looking at half, I would say it's half of whatever we negotiate as part of the essential staff.
Whatever the full day child care amount is.
Right. Okay. Right. As opposed to building it out at 215, because I think we can get it down from that.
Okay.
All right, so talking about just limiting it to licensed child care providers. Seeing nothing, all those in favor of saying it has to be licensed child care providers, say aye.
Aye.
All those opposed, say no. All right, so we are now on Mark's amendment, which is opening it up to any child care, a licensed child care provider, half of whatever the negotiated full week amount is, as basically a dollar credit towards that teacher who has that child care.
Okay, and something, I mean, the concern about containing cost, I mean, how do we do that? And I think we could entertain putting a cap of 200,000. And if we hit 200,000, we prorate it by the staff member. So each one would get less than the, so that everyone within can get a portion, but maybe not the whole thing anymore.
Are we in discussion or are we?
We can't do that now
No,
because there's
but
already been two
that's
amendments. You
part of the
have to have a
discussion. I
follow-on
think that's something we
motion
could talk about.
later. Okay, Brian, you have a comment?
No, but I have a question for Brian when we get there. Or can I do it now?
Sure.
Does this have to be done tonight? Because I don't like I'm uneasy about any numbers that we don't know. And I think it's gonna grow way bigger like you said. I mean, I'm all for trying to help the teachers out with childcare. I just don't know if we're gonna get it done tonight and without solid numbers.
Could I call the question for this?
Did you have more to say? It's
No,
still, he says.
I mean, does it need to be done tonight?
I
We
guess
meet
what I
next
would ask is that leaves, no leaves of any staff member would start minimally until they're returning to work. because that could be the earliest point at which they would lose their childcare. So the earliest point at which staff could be accessing this would be the 20th of August.
I know everything's time sensitive now. I'm really uneasy about not knowing numbers and finances, and that scares me a little bit.
You're.
Call the question.
There's call on the question, but it does need a second. Is there a second? There's a second. This is non-debatable, so we're just voting whether to end discussion. All those in favor of ending discussion, say aye.
Aye.
All those opposed, say no. We are now voting on Mark's amendment to open it up to any provider, basically, on half of the negotiated amount. It will be the final end. All those in favor of just the amendment, say aye.
Aye.
All those opposed, say no.
No.
The motion fails. That takes us back to Jack's original motion, which is 50% of the negotiated amount at the youth company for those teachers under Brian's, I don't know how to phrase it, the test, the accommodation. Is there any further discussion?
Is there any flexibility in them expanding another class? If we say we had 33 come forward for the all day and there's only 30 spots, do we know if there's a possibility that
Their limiting factor is staff.
Yeah.
That's, I believe, from my conversations, really what they're trying to build off of is what they feel they can deliver.
Yeah, I didn't know if they have a legal limit too that they have
They
to
have a
maintain.
legal limit of 15 per class. That's
So-
because they're under the daycare regs.
I had a question on that. Will they be using the same staff for pod, the morning pod and an afternoon pod? It'd be the same person
That's how they described it
So
to
they're
us.
gonna
Yes.
try to keep.
with a 15-minute separation for cleaning the room. Are we providing different rooms? Because that doesn't seem like enough time to clean the room.
Is this still up for discussion?
Yes, the original motion is up for discussion.
I call the question on that then.
Is there a second for calling the question?
Second.
There is a second. So those who want to end discussion at this point, say aye.
Aye.
Those opposed, say no. And we will now vote on the original motion. All those in favor of the original motion, say aye.
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 All those opposed, say no.
No.
It sounded like 4 to 2.
Maybe you need hands.
Okay, we'll call hands. All those in favor say aye. I did not hear Brian's voice. Yes, 5.
I don't know if I said anything.
You're making it hard on me, aren't you? All those opposed?
Nay.
I think I wanted to. Couldn't get it out.
All right, thank you. So our next piece is that'll be a piece that Brian can now start working forward with, and we'll continue to keep you updated as that goes forward. All right, let's keep rolling through here, Dave.
Yep.
All right, the next item we have, I believe, is start of school year. Is that right? I gotta get back. Yeah, one of the things that we talked about at the last board meeting was with regards to giving us latitude administratively for start of the school year dates and times. What I've outlined for you is what our district level plans are, starting as early as this past week with some of the remote learning. We have new teachers coming on August 20th, on August 14th, and all of our staff returning on the 20th. So you can see the pathway there as far as how we're starting our work. We then also have, we have a K-4 plan with regards to the work that we'd be doing with really a training collaboration and a soft start to the school year with our K-4. 5-6, very similar type of a start to the year with the distribution of materials and collaboration for that week of September 1st, and a very similar piece with up for 7-12. And then full-on instruction starting on the 8th of September. but those first weeks being really those preparation, that first week of September being that preparation time as we move forward. So this was, just wanted to articulate for you specifically what you voted on and agreed upon last meeting. So any questions with regards to that? All right, awesome. The next item that I have was there has been a lot of motions that we've had over the last few meetings, so I just wanted to bring forward for your attention just kind of an outline of the different decisions that we've made between June 22nd and August 3rd. So I just put a memo to you that highlighted those. I guess I wanted to put that in front of you to make sure that we administratively were interpreting and reading those correctly. So I just wanted to check and see if there's anything that anyone on the board had questions about or we need to clarify. If not, then that's how we are moving forward with implementing all the different motions. And then the last item we have under this agenda item tonight is personal protective equipment. And I believe Mr. Ely is going to join us. I see him walking in the hallway right now. Mike had a question just with regards to the types of PPE that we would be providing to our staff, particularly our staff in the health offices. So I asked Kurt, who's really been heavily involved in that, and I see he brought some show and tell to show some of the items that we are able to provide to staff. So thanks, Kurt, for being here and sharing that, and I'll turn it over to you.
Sure. So I thought I'd bring some things that we have purchased and that we do have available. And then I'll also share some things that we have on order that haven't arrived as of yet, but we know that they are in shipment. So how we're approaching this is there's a document that the Department of Public Instruction has put together. It's called Ppe Considerations for Schools. So it kind of walks you through the different levels and layers of PPE items and considerations that you should use in determining if you should purchase and who should have access to those materials. So things that I have here to share with you are we have child size masks that we have purchased, and we have these. I have a box of these sitting in my office, and they're large boxes. I think it's 2,000 disposable masks that we have. This is a mask that we received from the state of Wisconsin shipment. It's a cloth mask. We received 9,000 of them. They are washable. The package says that you can wash them 15 times and then you're not supposed to wash them anymore. But we have 9,000 of these in the district. I also am working on placing an order of masks like this that would have the clear cutout so that your mouth can be viewed for some staff to be able to use those. We are working on placing an order for those with a vendor. Specific to our health office staff, we are working with SSM Health and another company to fit our health office staff, that would be our health assistants and our school nurses, with N95 masks. SSM Health, through their occupational department, would do the fit testing because all N95 masks need to be fit tested. So they would do the fit testing for us. And then the company Battelle, they do decontamination of N95 masks. And they have, their offices are located over by the airport, Truex, and they would decontaminate the masks that we would have. So our plan is that we would have purchase and have fitted 5 N95 masks for every health assistant, and they can decontaminate them in a day or two so that we would always have masks that would be decontaminated for the health office staff and would be properly fitted as well. We also have face shields. These are just two of the samples that we've received from various vendors, and we have made purchases as well. These are just your run-of-the-mill face masks. They do not equal a face covering or a mask, but they do provide additional protection when you're worn in conjunction with a mask. We have ordered the Badger Shield Plus, which you may have seen the news story a couple of weeks ago. The Badger Shield Plus is basically a face shield, but it has I'll kind of hold it up. It has a face covering that then is built into the face shield that seals it off from ear to ear under the chin. The Dane County Madison Public Health Department reviewed the Badger Shield Plus, and they did indicate that it does meet the specifications of a mask or face covering. So these do not, but that Badger Shield Plus does. So we have those purchased for staff to use. Today, I also am working with an admin assistant in my office to order some bucket hat shields. If you're familiar with a bucket hat, they have there's companies now that have taken the bucket hat and they've built a shield that's under the brim of the hat. And I was thinking when I heard about that on the public health phone call last Thursday, I was thinking that may be something that some of our students would feel comfortable wearing who may have some sensory challenges with their face masks. And if we could get them to wear the bucket shield, we'd have some protection, not equivalent to a mask, but it would be better than no mask at all, or nothing at all. So we're purchasing some of those as well. We also have purchased gloves, disposable gowns, and then eyewear, glasses, and or goggles, the kind that would fit over a pair of glasses if somebody has a pair of glasses that they would need to cover, as well as just glasses or goggles that you wouldn't have to wear over a pair of glasses. So that's kind of the extent of what we have at this point, either purchased and received or in the pipeline to arrive.
Is there a protocol for who should have to wear or will have to wear a certain type of mask?
Yep. We are using the PPE considerations for schools that the Department of Public Instruction has put out. Yes, that's what we'll be using.
Kurt, has there been any requests at all for anything else additional from any staff member for more protective equipment or anything else like that you haven't already done?
I would say the only other thing that we have had some requests for, and I keep working with John and Steve and Brian Grabarski on the plexiglass dividers, like what you see out here that Terry has, and we've decided that those plexiglass dividers are not going to be provided en masse to people because the level of protection, we can get a greater level of protection using some other things than a plexiglass shield. The aerosols with a plexiglass shield, they don't really protect that much.
There was a question about like plexiglass shields around desks, and there was a piece that came up at Public Health Madison-Dane County meetings. Because of the aerosol, they don't believe that it doesn't change the social distancing requirement or the masking requirements. So that's a piece that, as we looked at that, we felt the masking piece was the most important aspect.
Any other questions?
I guess just to say, I mean, the only reason I brought it up and asked to be on the agenda today was because I mean, I work in a field where people don't generally want to talk to me for positive things, and I think health assistants and school nurses generally may get left out of consideration at times by many parents or community members because you don't think about how often you're talking to them. But in this instance, when we have kids presumably in school, this is a person who's going to be seeing every single kid who doesn't have a note every morning. If a kid starts coughing and spitting up in class, this is the person who's going to be seeing every single kid. And those people are kind of like to a certain extent, they're like that first pawn you're moving out on the chessboard, every single move. And we have to do everything we can to protect them as much as possible. So I just appreciate you bringing stuff to the curb.
Yeah, sure.
All right, our next two items on the agenda actually have been handled in previous meetings. Co-curricular, we had a good discussion on. The committee obviously sent its recommendations. We dealt with those last week. So if you want to read the minutes, you can, but there's really nothing we haven't already dealt with. Same with HR. We've dealt with some of that, although if you read the minutes, you'll see they're going to be looking at some more items now that we've actually gotten to what our model is going to be, so there will probably be recommendations in the future from there. But there are some items in the curriculum committee to deal with tonight.
I believe Tim will be coming forward to talk about the assessment schedule and then the update to the human growth and development curriculum sequence that's being recommended this evening. Thanks, Brian.
And this is where we expect him to show.
We're getting too quick for everyone not ready.
Because it's not in there yet.
That's right.
You're all queued up, Tim. The floor is yours.
Okay. So curriculum committee. Yes. So if you look in your packet, you'll see our minutes for the curriculum committee. And under that, we do have two action items. One is our assessment schedule for the upcoming year. And, I think we all know that this is a very different year. We don't know at this stage how completely we will be able to implement our testing schedule. We're hopeful we'll be able to do it entirely. But for some of our assessments, there are things we need to consider how we would undertake them remotely. Some we know we can do remotely, some we may need to make some adjustments to. So what we have proposed here and what the committee forwarded to the full board is a testing schedule that's very similar to our regular testing schedule, asking that you as a board allow administration flexibility in implementing the testing schedule in the fall. We come back to you with a report at the end of the fall testing season to let you know how completely we were able to implement our standard assessments, and if there are any adjustments we recommend for the winter and spring, and we go forward from there. If you have any questions about specific elements, I would be happy to try to address those, but again, in general, we are going to do as much as we can, and we're optimistic that will be quite a bit of the schedule. And we feel that's important because we want to make sure we have as much good information as possible about where our students stand in their learning coming off of the emergency remote learning we had in the spring. We feel that's very important.
So is the fall testing moved up a little bit? Or is it usually the same time every year?
These are the same time frames with the exception of the ACT Aspire at the middle school. That has been moved up a few weeks. Historically, that's been one of our later ones, and we just feel with students coming off of last spring, we would like to have that information sooner than later. Jack?
Tim, how do you do this testing? Is it going to be online? Are we going to bring in groups of students, or how do we do this?
So in general, it will be online. Most of our assessments are computer-based. They typically occur on site. And what has happened is that our major testing vendors, which in this case would be Renaissance for the STAR testing, and it would be ACT Aspire for the Aspire testing, have certified their assessments for students to take them at home. Now, there's a recommendation that you have an adult there to help the student stay on task, but both vendors have certified them for home testing. So we feel that's what we would want to do. That's not the control conditions we would have in school. So we would need to see exactly how that operated. However, both vendors have had districts that have piloted this, and they felt that the results they had were in the spring were reasonable. And so we feel that would be the way to go. Where we may need to make some adjustments will be with some of our literacy assessments that take the form of running records. And those are assessments that are not computer-based. Those are interview type assessments where a student is reading a text to the teacher. Now, you could envision a scenario where you have a video conference, and although the teacher and the student are not proximate to each other, the teacher could observe what the child is doing over the web conference. Now, to get levels, and I'm going to vastly oversimplify what's pretty complicated, you sort through different levels of text. So you might have to make some adjustments in there. And some of the content providers are saying that the modality is different enough that they have some reservations about administering the test that way. So I think the running records are the ones where we're going to have to proceed the most cautiously, potentially looking at a substitution. We'll just have to see.
Thank you.
I would make a motion to accept the testing as submitted.
Second. Second by Mark. Any further discussion? All those in favor of testing, say aye.
Aye.
All those opposed?
Thank you.
And next is human growth and development.
Yes. And so, as you know, this has been an extended process. We had not really had a thorough relook of our human growth and development sequence since 2008. And I would say that the human growth and development sequence had not been substantially revised since sometime in the early 1990s. So it was very due for a look. We had an outstanding advisory committee that worked very hard at their work in starting in the spring of 2019, and they concluded their work on the edge of COVID on March 3rd of this year. And you can see their March 3 draft, and the notations in there. If it has a number, that's a benchmark from the 2008 scope and sequence. If it is noted in red, that would be a new target. This was a consensus from the advisory committee. We shared the committee's recommendations with our health instructors at the middle school and high school, and also with grade level teachers and counselors in the elementary schools and the intermediate schools. And the feedback from the educational staff was positive on the recommendations, and so the curriculum committee moved to advance this to the full board for consideration. The way we would proceed is laid out in the recommendation memo, that we would then begin to implement this realistically given the circumstances we're currently operating in. Instead of a 1-year implementation, this could potentially extend to a 2-year implementation. We'll do it as quickly as we can in a quality way, but we have to recognize some of the constraints we're under. Would recommend we keep the advisory committee in being to provide feedback on the work. We do have some students who were seniors this past year that have graduated off the committee. So I anticipate coming to you in the fall with some recommendations to replace them. And then we would also look at the element of communication and making the information on the website more accessible to parents so they can be true partners in the learning in this area. So again, I think there's a lot of consensus here. These are overdue updates. And by keeping the advisory committee, we have the opportunity to see how these updates play out. We would get some feedback from students, and we would potentially look at additional adjustments depending on how the initial implementation phase went. Questions?
Have you considered just getting public comments on this, put this document out there for, you know, a period of 30 days or something, just to get public, you know, because we've got the advisory committee. I know we picked out a great committee there, but just getting some public feedback.
So we had some public engagement parts in the committee's work chat. The committee had a parent information session, and we also surveyed parents. And the committee took into consideration both the discussion at the parent information night and also the survey input. And so you can always get more feedback, but I think compared to previous revision processes, we had more public feedback in this process than any of the previous ones. I think what we might potentially look to do here, my advice would be, let this move forward because it has been generating for quite some time. We're going to keep the advisory committee in being. We'll get feedback on the initial implementation phase, and additional public feedback can be from not only students but also from parents, can be part of that process. And that can go into our phase of monitoring and adjustment.
How many people did you get involved in your parent meeting?
So I think the night we did the parent meeting,
Probably had 50.
we probably had about 50 in the PAC.
And probably a 2-hour discussion.
Probably, it was a 2-hour discussion, and 50, which, you know, compared to the kind of, you know, we probably have about 200. This is a slow night, by the way, on YouTube for you all. We only have 200 people watching your proceedings tonight, at least last time I checked. But, you know, by pre-COVID standards, 50 for an information session is actually pretty good. I remember our Common Core information session back in 2011 had about 25 people. And we had a few hundred people take the survey, both with selected response and also comments. So, I mean, again, by the standard of pre-COVID, that was a pretty high level of engagement, and we would kind of seek to circle back to that in the implementation phase.
The other thing you might want to point out, Tim, is the makeup of the committee, how many, the different groups we had identified on that group.
Mm-hmm.
The board may have forgotten about there was a huge, for advisory board, community stakeholders
Yes.
on the committee itself.
Yeah, so of all of the things that you do as a board and we do as a district, human growth and development is one of the more regulated areas outside of, say, special education. And so if you do look in the board book, in the presentation we provided that evening, we did have the state requirements outlined in there, the composition of the advisory committee. You have to have certain groups on the committee. So you need to have members of the clergy, you need to have health professionals, you need to have parents, you do need to have educators, but district employees cannot be more than 1/4 of the committee, and no constituent group among the various groups that have to be represented on the committee can be more than 1/5, except for parents generally. So you do have to have a lot of representation on the committee. And we were very fortunate in the quality and dedication of the people that you appointed to the committee.
Any other further questions? Otherwise, all those in favor?
We have a.
We don't have a motion.
So I
Oh, we need a
move we
motion, sorry.
accept the recommendations from the Growth Development Committee.
Second.
All those in favor say aye.
Aye.
All those opposed?
Thank you.
And that takes us on to the facility committee.
For the facility committee, I'm going to let Steve run with the items that we have in front of you tonight. We have a number of items that the committee reviewed and are bringing forward with recommendations for consideration. You know, Steve and John have worked through these since the committee met, so I'll turn it over to Steve to walk through those.
Thanks, Randy. I want to start with just a high-level conversation first before we get into any of the particular agenda items. So, Brian, you weren't here last October, but last October, I just want to remind all of the board members that you approved what was called a reimbursement resolution. And what that means is that a bond resolution in the future can be utilized to pay the district back for the topics covered under that reimbursement resolution. We selected district-wide maintenance projects under the reimbursement resolution. That resolution that the board approved last October was approved with the thought process that we would be having a capital referendum question this November. We have now shifted that discussion to 2021, but the reimbursement resolution that the board passed is still valid. It was not tied to November. So keep that in mind. It's still valid, it's still out there as a resolution passed by the board. What is connected to that reimbursement resolution is the bond referendum has to take place within 18 months of when the project that you're putting into service is available for use or the invoices are being paid. So with any of the topics that we're going to talk under the facility committee tonight, excluding the equipment, so for capital projects and capital projects that the board has actually already approved that took place this summer, the school board has the option to request paying back the district for these expenditures out of a future bond referendum. Now the 18 months is important because if you look at the election calendar, there's not a lot of options within that 18-month window. So I think as you're looking at the HVAC and the plumbing piece tonight and are interested in the topic of utilizing the reimbursement resolution that's been passed, I do think the board is going to want to take a very close look at a minimum, a capital maintenance referendum within that window to replenish the funds in our Fund 41. That likely means looking at that April dates that the board has already looked at. That doesn't mean that that has to include other projects, but I think the board certainly would want to keep in mind that 18-month window and keep in mind that you could move forward with a referendum for, again, capital maintenance projects. That was a key component of the discussion that was already occurring, leading to discussion around a November referendum. But if you do approve some of these projects tonight with the intention of reimbursing the district back for those funds, that 18-month conversation is one that we all have to keep in mind and realize there's not a lot of dates available within that time frame. That may encourage the board to take a close look at the spring of 2021 for, at a minimum, a referendum for district-wide capital maintenance. And a part of that would be to pay the district back. I think it's fair to say that the board's intention and what we've been working towards the last 3 years has been to have a Fund 41 with funds available to be utilized for capital maintenance projects. I understand that we are in a unique circumstance with school reopening costs related to COVID, but I certainly think the board wants to consider the intentions that you did have in building up the funds in Fund 41 and the opportunity that you have available to reimburse the district through that reimbursement resolution that's already been passed. So before we jump into the particular subtopics, any questions at all about the reimbursement resolution, how that's tied to a referendum, and what we can pay ourselves back for, or why we would do that?
Steve, how does the discussion we began last meeting tie in with this one? Because if we're looking at potentially doing a fall referendum to move a set amount from Fund 39 into Fund 10, isn't that doing the same thing as the spring proposal would do as well, or not?
Yeah, that's a great question. So a little bit later on the agenda tonight, I'm going to talk about the topic I brought up last week as well, which was the concept related to an operational referendum question. And so when we were talking about our November referendum and in that planning process, we were talking about both the operational question and a capital question. So when I'm referencing paying the district back, fundamentally what that is connected to is a capital referendum question and the issuance of a bond, which is then utilized to first pay the district back. So as an example, let's say the board were to approve a $20 million referendum next April for capital maintenance projects. The first, let's say, 1.5 million would come back to the district to cover costs related to HVAC enhancements, plumbing enhancements, or any other projects that the board has approved. The remainder would then be available to look at the district's long-term capital maintenance plan, which you all know as board members has projects that have been identified and are waiting for the funding to do. So in this conversation, Mark, I'm more referring to a capital referendum with a bond issuance and debt repayment as opposed to an operating one, which we'll talk a little bit later on tonight.
Any other questions?
So would you actually do a bond for this? Let's say you know these projects are 2 million, 2.2 million, 2.25. So that would be a bond that would be paid over a period of 20 years.
Yes, exactly. So Jack's question is, would that be a bond that would be paid back over time? The answer is yes. But keep in mind, that's just an option. So you as a board, by taking your action last October, have set the stage for this being an option. So if we had not passed a reimbursement resolution and you were looking at HVAC system enhancements and plumbing enhancements tonight, you would not have the option to pay yourself back from a future bond referendum because you would not have exercised the reimbursement resolution, which is a specific action that a board has to take. So the board is in position to do whatever you see fit with this. I just want to remind everybody what you did last October, what options you have available to you. As a board, you could just decide to utilize Fund 41, spend that balance down close to zero, and not exercise the right that you have under the reimbursement resolution. I would suggest that goes counter to the 3-year plan that you as a board have been putting in place to try to have funds available in Fund 41 for capital maintenance projects. But just wanted to lay that kind of foundation down as far as how this would work depending on how we move forward over the next 18 months. So then I can jump into the specific agenda items under the committee. The first one is consideration of deep cleaning equipment. If you looked at the notes, you did see that this one is different in that equipment that is used for operations of buildings cannot be paid for out of Fund 41. So the equipment that you see in front of you in this proposal for deep cleaning is equipment that we would need to pay for out of Fund 10, so the district's general fund. And this is equipment that we are recommending to be able to complete a more thorough deep cleaning process of our buildings. This is equipment that we currently have tested. Some of this equipment we have purchased, as an example, a backpack sprayer and some of the handheld. We have tested them, we've utilized them. And this is equipment that would be an improvement from what we currently have available to do deep cleaning. The committee took a look at this and is recommending the purchase of the handheld sprayers. The handheld sprayers are easier to operate for the members of the custodial and maintenance staff. The backpack sprayers are challenging, just given the weight and needing to carry those around on your back. But I did note in here, we did need to order some additional backpack sprayers, so we knew we would be ready for the first day of bringing students in. There is a bit of a back order on the handheld systems at this place at this time, but we are still requesting moving forward with the facility committee recommendation to move forward with purchasing the handheld sprayers for deep cleaning of the school buildings. And this will provide us with the opportunity to enhance our cleaning efforts when students return into our buildings, both at the K-4 buildings now and as students enter into the 512 buildings in the future. And the facility committee members, I'm sure, would be happy to answer any questions from the rest of the board members regarding that recommendation.
Are you still going to order the one back sprayer?
Yes.
I make a motion to purchase the deep cleaning equipment.
Second.
Any discussion? All those in favor say aye.
Aye.
All those opposed? And HVAC enhancements.
So you do see some information attached regarding HVAC system enhancements. At the facility committee meeting, we did review information with the committee. We didn't have specific quotes, though, at the facility committee meeting. We had a quote for the high school. We had estimates for the other buildings. But the recommendation of the facility committee was to look at this HVAC system enhancement first at the K through 4 level. So last week, John spent some time getting specific quotes from North American Mechanical. We also were able to connect with a second firm, 1901 in Inc., to get quotes from them as well. John did walk 1901 through the buildings. Given the dollar amount that we are referencing, it was an excellent idea to have a second firm take a look at our buildings and take a look at this system. We did include those quotes for your consideration, so you were able to see those. The recommendation from the facility committee was to approve the HVAC system enhancements for the K through 4 building. That was brought forward on a 3-0 vote. That would need to be funded out of the district's Fund 41 initially, and then would be a Board of Ed decision at a later date as to whether or not you wanted to seek reimbursement for that. You do see that we wrote in here the quotes for the North American Mechanical was $212,215, and 1901 was $214,767. Those were received on Friday, right about the time that the packet was put together. So we did have, John Kramer did spend some time reviewing them today. But we have all of this included for your consideration. So the facility committee is asking the rest of the board members to take a look at putting the system in place at the K through 4 buildings out of Fund 41 with the potential for a reimbursement coming at a later date. And I'd be happy to answer any questions that anybody has. I know there's a lot of information about this in this agenda item, but feel free to ask any questions, or the committee members are welcome to jump in.
Sure. I guess the first thing I'll say is to be pedantic. The motion I made for the facility committee was to forward consideration to the full board for approval. Now, I didn't word it as recommending approval. And I only bring that up now because I'd like to hear what everyone else had to say. And at the time, we didn't necessarily have any additional input as to how this system specifically works. We were largely looking at simply what effectively the advertisements were about it. But I think everyone at the facility committee, and that was myself and Dave and Mark covering for Jack that day, wanted it considered by the full board as important to look at. So that's all I would add, just as to what Steve added and Stefano, anybody else.
I would make the recommendation to do it because it just improves not only for COVID, but the health of the building. For the flu, and bacteria, things like that. It's theoretically going to make it a more safe environment, for everybody. So I would make the motion to go with NAMI because they're low bid. They're already in our systems, and put it in the K-12. I mean, K4, I think is what we're talking about.
So there's a motion to accept the NAMI bid for the K4 schools. Is there a second? I would like to make an amendment to change it from NAMI to 1901. And the reason is it's $2,000 more, except the 1901 includes all the electrical work. If you notice point 3 under clarifications, they say provide all electrical work needed to power the GPS systems being installed. 1901 has their own electrical division, so they included that obviously in their estimate. For those of us who were at the facility committee meeting, it was pointed out that NAMI was not including the electrical wiring, which could be very significant considering how many locations they have to get power to. And we'd have to go to Westfall or someplace like that to get another bid. But with their bids being almost identical, it seems like we're saving a lot of money taking 1901. So is there a second for the amendment?
Second.
Okay, so we're just discussing the amendment between the two contractors.
Dave, could I mention that North American Mechanical changed their approach to electrical? So at the facility committee, it was not included, but John requested, I'll call it turnkey proposals from both of them so that we could look at an apples to apples. So I just need to find that so you can see that that was included, but that wasn't changed. So what you saw is correct, that originally the electrical was not included in the proposals, but the new proposals that we received, I just need to grab them here.
I have theirs under project scope of work. Power supplies to be installed within 6 feet of cooling wire. Includes electrical power wiring to power supply, but then, well, it gives different voltages.
So
who are they contracting with to do this electrical work?
That I can't answer. All I know is John heard the committee about the concern about
Right.
not knowing what the electrical cost was, asked both firms to quote total cost so you could see it as a board, and both of the proposals should have comparable work in them, and there would not be the need for that additional electrical cost, but I can't answer the question as far as who would specifically be doing that work, just that we wanted to see the total cost to be able to compare it.
do we really care who they use if they're giving us a turnkey solution?
I do care a little. We've had problems before. I'd rather not go down that same road over a $2,000 difference. But
But we didn't specifically say, use this contractor because.
No, but every other time we've had
We
NAMI
asked
submit.
them to, if I'm hearing Steve correctly, we asked them to give a turnkey solution. And they're already working on our systems.
Steve, I'm not aware of discontent with NAMI.
So, excuse me?
Have we had any issues using NAMI in the past? I mean, they're the ones we contract for right now. I haven't heard any discontent that I can recall.
Our only problem with NAMI in the past has been because of our control systems, we've had no competitive bidding with them whatsoever over the years I've been here. And that's been problematic because we never know what the price is. Luckily, someone watching one of our board meetings over the last couple weeks happens to be part of 1901 and is a resident in our district and just said, hey, we've been installing this system. We put it in Exact Sciences and everything, which honestly, the best part about talking to him was the fact that he was able to tell me that how good the system was and what it really did, other than an advertisement. But he didn't necessarily want the work in that sense. He just wanted to say, you guys need competitive bidding on something this large. And so I said, great. And I got him in touch with John Kramer, and that's what led to this second bidding process. In the time I've been here, we've never had NAMI submit electrical before. They've always usually been, they'll submit their part, Westfall, or someone else will submit the electrical. It only makes me a little curious in the fact that this one's done different than all these other times. I didn't pick up when I first read how they wrote it. It still struck me they were going the same way. I haven't brought up the one from the previous meeting to see if this project scope of work has changed wording or not. I'd have to go back to the first facilities meeting. But it just made me curious where their number came from and who it is. Because we've had problems with door controls and everything like that by bringing in another contractor who's not with our system. As far as these things, this GPS ionization system, it's plug and play. If you can sit there and cut it into the system, you literally plug it into the nearest outlet and you're done. It doesn't take, you don't have to know the system you're putting it in order to put it in. Any different than you can take a light fixture and take it in the room and plug it into the outlet and you're good to go. But electrical, getting into our panels and all the other stuff makes you a little concerned when a contractor who's not certified for doing electrical is suddenly telling you they're going to do electrical. Or they're getting it from somewhere and we don't know who it is.
But what you're doing is requested each contractor to do a turnkey solution. I don't think NAMI's going to do bad work or bring in somebody that's going to give us problems. So given that they're low bid, and they're here in our system, I would stay with NAMI.
Is there any consideration for doing this to Heritage when we're looking at major changes down the road?
This includes Heritage.
I
And
know.
actually, the part is transferable to new equipment. It's magnetized to the units, and so it's easily to remove and then, depending upon what you have in the new system,
So if we took down Heritage, it could be taken out before
if the
we
new
took it
system
down.
We could reuse all of it.
right.
That was one of the early questions.
So John heard us on YouTube, so thank
Oh,
you
John?
for joining us. John did the work to contact the contractors and try to get the proposals to be complete. after the facility committee. Do you have anything to add, John?
I do, sure. So I ran from my house, I'm a little out of breath. I'm just kidding. Yeah, I did engage with NAMI. Thanks for clarifying that. In the email I just gave to Steve, our rep said that he has included the electrical costs in the quote that they provided. And NAMI, I'm sorry, I'm really out of breath from running down the hall.
That's your bedroom, right?
NAMI has engaged with our electrical contractor, Westfall, to collaborate on this project. So I know, Dave, you're asking who that would be. They did engage with Westfall.
Okay.
They know they're our partner in the district. So.
Then I'll be happy to vote down my amendment.
What did you say, Dave?
I'll be happy to vote down my amendment. So the amendment on the floor is to switch it to 1901. It's seconded, so any further discussion?
Call the vote.
All those in favor of the amendment, say aye. All opposed, say no.
No.
So we're back to the original one of just approving NAMI. All those in favor, say aye.
Do we have
Oh,
any further
sorry,
discussion?
further discussion?
What is happening with the other buildings? I know we're just focusing on this because that's what we're opening, but will we also be putting the system in
We were
the
told
other
that
three
the
buildings?
we were told that the timing for ordering and getting this done is like 3 to 5 weeks. So our decision was, at the facilities committee, we discussed just doing the elementary right now. And then as we look towards opening the other buildings, we would then, of course, get ahead and consider paying that then, due to the fact that that's another $600,000. Further discussion?
Hey, John, thanks for doing the work and looking into it. This is something that I know, I don't mean to say this if I've already said it before. I was bugging John about it back maybe in November, December, because I'd had the experience of being in one of the buildings and having it be a very different experience from the building I was used to, just in terms of air quality. I have asthma and I have a kid who has asthma, and it's an equity thing, really. And like Jack said, regardless of COVID, this is something that will improve the air quality, hopefully in all the buildings we're in. So it's a good thing to do that I'd be in support of, whether or not we had to deal with trying to remove viral issues from the air. So I'm glad we're talking about it now.
Yeah, I think it's good technology as well.
Call the vote.
Seconded.
All those in favor of calling the vote, say aye.
Aye.
All those wishing to still discuss, say no. And we are now voting on approving the contract with NAMI for the $200,000 and doing the 3 K4 schools. All those in favor say aye.
Aye.
All those opposed say no. And the motion passes.
The last item under the facility committee was the plumbing fixture enhancements. So John presented a list of plumbing system enhancements that could be considered. The list was pretty extensive, and it exceeds our ability to cover both plumbing system enhancements and HVAC system enhancements within the funds available within our Fund 41. So last week, John and his team, after the facility committee meeting, focused their efforts again on the K through 4 buildings and focused their efforts on basically water bubbler systems to present to you tonight estimated cost on switching out water bubblers to touchless bottle filler systems in our locations in our K through 4 buildings. If you approve this concept, again, we'd be looking at a second phase with the other school buildings to make sure that we have these systems in place. We aren't able to go into all of the restrooms and do touchless faucets and sinks and all of that throughout an entire school facility. It certainly is something that we can take a look at in the future. but making sure that our access to water is a touchless system. You probably have walked into locations where you've seen them crossed off with painter's tape and caution tape. Our goal would be to provide student access to water using the touchless systems. So what we've got in front of you tonight is an estimate of $73,500. This was not a recommendation of the facility committee because we just showed the committee a huge list. And after the committee meeting, we focused in on this particular topic to show it to you this evening. And so we're looking for some discussion on your thoughts regarding moving ahead with this type of a plumbing fixture enhancement. John's here, his team did the work. John did the estimating, so if you have questions, John's more than happy to provide the detail for you.
So are you looking for a recommendation to do all of this, or just the drinking fountains at 147? And also, is this in every classroom? Or is that, you know, where are the 345 faucets?
The 21 bubblers that Steve was talking about with this current topic are located in the elementary schools, so we're only talking elementary schools at this time. We're also talking about areas in the elementary schools that only have standalone bubblers. So if we have a bottle filler and a bubbler right next to each other, we're not counting that piece right now. We're thinking that's adequate for the kids to go and use the bottle filler and disable the bubbler at that single location. So we're talking about locations that have only bubbler water fountains. So with that water fountain out of service, they would have no water at that location. So the 21 locations at the 3 schools, again, are standalone bubbler locations that would be replaced.
Yeah, there's not a document for this, right?
So the document that's in here is just the form of mediate. We're not looking at that. We're just
Right.
looking at
The document's the all-in number, and what you granulated it down as to 21 bubblers.
I mean, they're great systems. I see them more for high school kids and college kids that walk around with water bottles all the time, but I think we're gonna have to do it everywhere anyway at some point, but let's start somewhere. I'm in
the
favor of it.
recommendation to spend money and put them in.
So that's a motion to approve the $73,000 for bubblers.
That's correct.
That's right.
And there's a second from Brian. Any further discussion? Yep.
Be aware that I've taken the estimate for this project through 5 past projects that we've already done in the district that include bubblers and bottle fillers. So this is not an official quote from a plumbing contractor at this time. But just know that the average that we came up with for the project is around $3,500 per installation point.
So if we do a not to exceed $80,000,
That would be accurate.
Okay, so the motion is not to exceed, what did you say, 73.5 or 75 or what? Your motion is not to exceed
80,000.
80,000. And you second not to
second
exceed
that as well.
80,000. Any further discussion? All those in favor say aye.
Aye.
All those opposed say no, and the motion passes. I would like to point out that the worst thing in facilities is always about, we have X amount of money, but we're always trying to get bids. I'm really thankful to that community member who contacted us from 1901, because the original price estimate, as I look back at the facilities meeting from NAMI, was $175,000 to $200,000 just for Heritage. It was $40,000 to $50,000 for Arboretum and $70,000 to $80,000 for Prairie. We would have paid $150,000 extra if we hadn't had a competitive bid. And I'm going to be hammering that as hard as possible, because right there almost doubled the cost of our project, because we've used that same contractor time after time after time, and we haven't been getting competitive bids against them, and we're going to have to do that now.
But did we ask them for a specific quote on these? or did we ask them to do this?
This was from their document that they gave us that didn't even include the
The question
electrical.
is did you ask them for a specific quote on those buildings?
The high school was the only specific quote. The others were estimates.
But when you're almost
You
double
know,
the price.
I've done government contracting, and when somebody asks me for a quote, it's always high. Because you want to make sure that they've got the budget, and if you, I agree with Dave, we need to have competitive quotes on this, but when we're asking for estimates versus hard numbers, there's a difference.
So that should end facilities, and now we're on to the fourth draft of the budget.
So, under administrative reports, our next step is we have a number of items under here. The first one is the fourth draft of the budget. I'm going to keep Steve on the floor here, and he's going to walk through this fourth draft as was requested at a previous board meeting, as we were particularly articulating and approving different costs associated with the reopening plans. So, Steve, I'll turn the fourth draft of the budget over to you.
Well, thank you, Randy. So the board requested a fourth draft of the budget to be brought forward for the meeting this evening. That's not typically what we do in August, but given the circumstances and all of our school reopening costs and conversations, we're bringing forward a fourth draft for your consideration tonight. In your board book notes, you see at a high level some of the financial strategies that I have included in the fourth draft. So I want to make sure that as a board you understand what has been put into the fourth draft and what we talked about last Monday, which was various financial strategies that could be utilized. So I want to just make sure I go over those. We've also, if you can recall, during some of our meetings regarding school reopening planning, I've talked about how services like food service the decision on the food service delivery model has to be made after the educational delivery model. Well, we're at that point tonight where we need board input on our food service program and the food service budget for Fund 50. So that's one of the topics we have to cover under this agenda item as well. On the food service end, we did provide a handout, and when we get to the food service part, I'm going to ask Hvac, our food service director, to join us at the table for that conversation. What you see in front of you, I'll go through items 1 through 6. The first one is we are adding into our Fund 10 budget the federal CARES grant funding related to COVID. That's a little over $63,000. We've talked about that at a couple of meetings. That's the only funding that our district has been eligible for so far related to COVID funding. So that has been included into the fourth draft of the budget.
Steve, question on that.
Yep.
That 63,000, do we have to share that, or is that coming directly to our district?
So the 63,000 comes to our district, but we will have to share it if any of our private schools, which would be St. John's or Madison Country Day, decide to opt into the program. It's very similar to like the Title I or Title II programs where they have to decide if they want to opt into it or not. The 63,000 actually is allocated to the district. We then might have to allocate some of it out to the private schools.
Have you had any indication that they're going to?
At first glance, there was an interest in participating. It all depends on the amount of documentation that is required to go with it. And we're still learning what that is right now because the DPI system was just opened up. But at first, yes, there is an interest in our private schools in participating in that. The dollar amounts, again, on this one are very small and are only going to cover a fraction of the costs related to school reopening. But you will see that in the fourth draft of the budget. an update to Fund 73. So this is the financial strategy number 2 that I talked about last Monday. That is the strategy of utilizing existing funds within our employee benefit trust fund to pay our expenditures for the 2020-2021 year. That frees up $587,000 in funds. We're not asking you as a board to determine what to do with that money right now. We're just asking you to utilize that strategy so those funds will be available for you at a later date. Whether that is additional staff costs, whether that's additional overtime costs, whether that's transportation costs, those funds would be freed up under strategy number 2. That decision would need to be made tonight because we do have to start making payments into the 2019-20 retirees accounts and retirees from prior years. That has to be done by September 15th. So at this point, I'm including that strategy in the 4th draft of the budget. If you as a board do not want to exercise that, we would need to remove it. Strategy 3 is an update to the Fund 10 with a dollar amount equal to $298,000. So that is financial strategy number 3 that was presented at the last meeting. What I didn't know at the last meeting was the exact dollar amount. So this is the Budget Committee's recommendation to have the buildings and the departments provide funds back to the district for school reopening costs related to the school closure. Okay, so that totaled up to $298,000. So those funds are now available to the district, and my recommendation for number 3 is to allocate those funds to both the maintenance and technology budgets. We know on the technology end, you've heard from Herb on the purchases that we've made for one-to-one technology and staff laptops. The existing technology budget is not large enough to cover the costs that have been made. And we've already heard on some of the maintenance expenditures that we're going to need to have as well. So basically, strategy number 3 is reallocating money from buildings and departments that were turned back to the district to the maintenance and technology departments. Strategy number 4, we talked about district budgets and looking at district budgets and reallocating them. For strategy 4, at a minimum, at a starting point, I'm recommending that we do not purchase any district copy equipment in any of the buildings. That's $60,000, and turning those funds over to the maintenance department for items that are much more greatly needed than replacing our copiers. You will notice what has not been included is tapping into the district's contingency fund. So we still have a contingency fund of $100,000. That strategy talked about potentially utilizing contingency funds. That has been a concern of the budget committee members, trying to maintain a $100,000 contingency. So please know that this budget still maintains a $100,000 contingency. Item number 5. Item number 5 was feedback we received from a parent who suggested, rather than adding onto supply lists all sorts of wipes and hand sanitizer and having our parents go out into the community and compete with each other to try to buy these products and bring in a bunch of different brands, the suggestion was apply a $50 fee per student, utilize the district's purchasing power to purchase hand sanitizer and wipes, and have all of that available to students rather than put it on supply lists. So these would be individual use supplies. These would be supplies the students would use. So this suggestion, which I think has a lot of merit, is approaching it from the district buying these items, charging a fee instead of the parents providing them. So in conjunction with number 5, if you do approve that, it would result in a new student fee being added that we would add when a school is brought back in. We would not add it for enhanced remote. We'd add the fee like at the K through 4 buildings right now for the students coming back. And around November-ish, if we bring back students in other grades, we would add that fee at that time. So that's really what that strategy is, and those funds are being allocated directly to the maintenance budget to then turn around and buy those items for students.
Is that fee just to the people that go back?
That fee would be just for the people who go back. Yep. Yeah, we would apply that fee to the in-person learning students.
Well, from a health perspective, that makes sense too, especially with what we've been seeing in the news about every hand sanitizer is not equal, and some are actually dangerous. So it would allow us to provide a safe option versus an unknown option.
Yep, and that's exactly what the parents' point was. Number 6 talks about the facility committee recommendation that we acted on previously, looking at HVAC system enhancements and plumbing fixture enhancements. In order to utilize those funds in Fund 41, we have to revise the budget. So the Fund 41 budget was revised to allow decisions to take place, not only with what you did tonight, but then also to look in the future months for HVAC and plumbing enhancements at the other facilities. So that's the adjustment to the Fund 41 budget. What is not included right now, again, another major topic that I brought up last Monday, that is the Financial Strategy 1 from the report last week, which is the proposed property tax levy, and looking at Funds 10 and 39, and looking at an operational referendum question to move approximately $2.1 million in funds from Fund 39 to Fund 10. So keep in mind that right now, those funds are included in Fund 39, which is the district's debt service fund. Brian, you weren't here last October, but what happened is the Budget Committee made a recommendation to the full board to keep the equalized tax rate in the community consistent from one year to the next. By doing that, the board was able to levy $2.1 million to prepay debt. So for those who have mortgages on your home, it's a similar concept to making a double mortgage payment or paying ahead on your mortgage. We exercised that last October for $2.1 million. So we paid down future debt. But those funds, those $2.1 million in property tax funds, are currently built into the property tax levy for 2020-2021. So financial strategy number 1, which we do have a meeting scheduled for next Monday, would be an operational referendum question, because only the public can take those funds from a Fund 39 levy and move them into a Fund 10 levy. Again, the advantages of having it in a Fund 10 levy are significant in that it then opens those funds up available to the board to be used in the current fiscal year. If those funds remain in Fund 39, the only choice you as a board have to do with those funds is to pay down debt that's 5-10 years down the road. If it's in Fund 10, you have the ability to look at operational expenses. And perhaps a much larger topic would be if the state of Wisconsin has a budget repair bill, this would allow us to get ahead of that. This would allow us to be prepared for potentially whatever might happen yet this fall. So that strategy puts us in a strong position. From a taxpayer lens, this does not increase the property tax levy at all. It just moves the property tax levy from one fund to another. We certainly are going to have to communicate that out to everyone to help them understand. Certainly Wisconsin school finance accounting funds and the rules is not something that's going to be really easy to communicate. We certainly have someone back here who can help us, but we've got to get that message out to folks as far as what that operational referendum question would really be intending to do. You've got in your board packet tonight the ballot language that would go along with that. That's in there because if you have any concern about what that looks like, we have to change it this week, because next week is when you would take action on that, and I would need to get back to our bond attorney this week. So that language is written very specifically. So first of all, there's two types of questions. There's non-recurring and recurring. Recurring means permanent. So we would want this shift to be permanent. That's why this is written as recurring. Non-recurring would mean you'd have to go back to the public on some interval and continue to ask the same question. Our district has utilized a long-term strategy that operational referendum questions are recurring. I'm sure you've heard of some districts who use the non-recurring route, and they have to float these referendums every 5 years or 3 years to continue to ask for operational expenses. We've gone the other route, and we've asked for these to be permanent. This is written, if you look at the actual question, for operational and maintenance expenses. That means you as a board are going to decide what that would be. So if this passes, this provides you as a board with the flexibility to decide. And I talked about this briefly last week. Operational expenses can mean that if we have a capital maintenance or capital bond referendum, and if that includes additional square footage or a new school, these funds can be applied towards that in the future. So in effect, we're looking at separating, I would say, the capital bond referendum question from the operational question. And we're bringing the operational question forward before we'd be bringing forward the capital question. The advantage to doing that is you have access to those funds now, as opposed to those funds being locked into a debt service fund. And then the other thing that I had on there that I wanted to make sure we touched on tonight was food service. But before I jump into the food service piece, I want to make sure everybody understands numbers 1 through 6. Is everybody okay with numbers 1 through 6? Or is there anything on there that the board feels that should be pulled out of the fourth draft of the budget at this time?
So the fourth draft of the budget, if I look at that, we're giving pay increases to everybody.
So the salary increases, great point, Jack. A large component of the budgeting process that we do each year is look at an estimated increase for salary and benefits. We've been carrying the same dollar amount for an estimated salary increase since the first draft of the budget back in May. It has remained consistent from draft to draft, and the board will have in front of you a decision come later this fall on pay increases. So we have an estimate in the fourth draft. That estimate remains the same as what you've seen throughout the documents, but with an understanding that no decision will be made until later. And in fact, you may want to know, if you move ahead with this operational referendum, that complete picture. Is there going to be a state budget repair bill or not? Is there going to be additional resources from the federal government for school reopening? would this referendum pass? You probably will want to understand your total financial picture, but as of right now, the dollar amount remains what it was back in the first draft in May. And so that's still consistently there as a placeholder for that discussion when that comes forward. So if there are not any questions on numbers 1 through 6, are there any questions on the ballot language that Rebecca brought up, or are you comfortable with us proceeding with moving forward? And you do see in the notes I did mention I'm having a medical procedure on the 17th, so I will not be at the meeting. I delayed that past the audit. I really wanted to wait until the audit got done, which was this week. So if there's anything anybody wants to know about that, I'd like to answer anybody's questions right now regarding that strategy and what that looks like, just to make sure that everyone feels you're comfortable with at least understanding what that looks like. I know the vote will be officially next week, but if you have questions at all about the strategy, Mark?
So Steve, if we choose to put it out, and if it were to pass, money would go from 39 into 10. If we found our costs were less than anticipated, can we move a portion of that back into 39 just by board decision?
Okay, good question. So the way that we would have to approach this strategy is at the end of October, the school board would have to actually levy 2 different tax levies. And we did that back in 2014, the last time we had a referendum in November. You would approve a tax levy as if the referendum passed, and you would approve one as if it didn't pass. And once we knew the results of the referendum, whichever direction it would go, those tax forms signed by the clerk would then be mailed out. So no, you would not have the flexibility to do that. You would either be putting the money in Fund 10 or Fund 39. Now the advantage of having those funds, another advantage in Fund 10, Mark, is we've fallen below our threshold for fund balance. So in the event that there isn't a state budget repair bill, which would be great, or additional federal funding comes, which would be great, the board will have the option to say, we've drawn down our Fund 10 fund balance, we're going to build it back up by $1 million, or we're going to build it back up by $500,000. That would be completely your decision.
You said between Fund 10 and Fund 39, you meant 10 and 41, right?
So
No, 41's the capital.
39's for
39's maintenance.
Yeah.
If we do this though, this is taking our defeasance money that we've done the last year or two, and that would mean our debt will be higher when we go for a capital project, which means our calculation of having the 120 million for a capital project with no tax increase will be a bit off. I don't think it'd be significant though.
So, yeah, so what Dave
Since
is
we're talking a short
referencing,
time frame.
yeah, so what Dave is referencing is another advantage to the tax rate consistency that the board approved last year, is that would have intersected nicely with the referendum question, and it would have limited the increase required of taxes if that referendum were to pass. The calculations that you saw regarding the November referendum included both an operational component and a capital question. If this 2.1 million is close to what we were thinking about for an operational referendum question anyways, the total scope of the dollar amount on the tax levy is not going to be that much different. If the board was thinking of an operational referendum question of like $400,000, then yes, this is going to make a noticeable difference in the information that you saw last year. But the operational referendum question that we were talking about, because of the size of a middle school and also some of the other maintenance projects that we were looking at doing, we were talking about increasing the investment into our Fund 41. This is comparable. So this is in the range of what we were very likely going to be doing anyways. And so I think it's going to be really close, Dave, to what we already looked at, because that operational referendum question was not going to be that far off from this. The one difference is the operational referendum question that we would have proposed would have likely been implemented over 2 to 3 years. That's a strategy we've implemented in the past. As an example, 600,000 this year, 600,000 more the second year, 600,000 more the third year. This would be 2.1 million immediately, but in the end, this is not going to be that much different than what you were looking at before.
I'm just not comfortable with the 2.2 million or 2.5 million, whatever that is, into perpetuity. I'm just not comfortable with that. Because as we go through this whole COVID, what does education look like in 5 years? What does it look like in 10 years? And this just goes on to the taxpayer forever. So I would put a sunset.
And what Jack's referring to is there's 2 different ways that these kind of referendums can be written. One of them is recurring and one is non-recurring. So this one was written as recurring. The primary reason this one was written as recurring is it would give you as a board the ability to then avoid another operational referendum question if you have a capital referendum question coming, let's say, in April. You wouldn't need to do it again. And the reason why typically they're recurring is because the costs on like a new building, like the intermediate school, are permanent. So typically you match up operational referendum questions permanently with the expenditures that are permanent. But I do understand what you're saying, because this is unique. This is a unique approach because we don't have in front of us a capital referendum question. What we have in front of us are school reopening costs and a concern about a possible state budget repair bill, and a concern that bringing more students back into the buildings takes resources that we currently do not have in the 2020-2021 budget. That would give us that opportunity. But you could look at this from a different lens, of a non-recurring lens, and look at it for the 2020-2021 school year. That's another way of looking at it. It's just, how do you see this fitting in to the next 6 months, year, and where you potentially would be going with operational referendum questions. They're both valid ways of looking at it, they just do different things. One's permanent, one's temporary.
I would feel more comfortable putting, if you're going with new buildings, you put the recurring maintenance for those buildings into your referendum. That now you've tied those two together, and it's justified. Because, quite frankly, if a referendum doesn't pass, this the way you've set it up here, it goes on forever.
Well,
And
correct me if I'm wrong, Steve, but because we approve, if, right now, this would have no tax effect on the public anyway, because of how we've been doing, reducing our debt. If we do this, all we're doing is saying we don't have to just use it for debt reduction, we can use it in other ways. But also, if we got to a point where, let's say the building referendum falls through, for some reason the public says we don't need a bigger middle school, we don't need a new one, and we still had this operational referendum, you don't have to levy it. You just have permission to levy it, but you don't have to. And I think, you know well, Jeff, that looking at our maintenance budget, the $350,000 we're putting in a year in there isn't even a quarter of what we need. So we know $1 million of this was going to happen no matter what, just to try to get our maintenance budget in line with our annual expenditures. So half of this referendum is going to be eaten up just by that, no matter if there's a school or not, if we do this. You need to know now whether it's going to be recurring or one shot, right? In order to get the language ready for next week.
Yes.
can you put it in there for 5 years? Could you put that language, or does it have to be either recurring or not?
Districts do that all the time.
So we could put it in there for 5 years.
Yep, that's a strategy that's used quite a bit by school districts.
So what we do, you know, if we change the language to sunset after 5 years, then we have a better picture of where we're at.
You just changed the language from recurring to non-recurring, and you'd insert the 5 years in there as the term for how long it would recur. It would be
Correct.
in place.
And then future boards can make that decision on, you know, do they want to?
Well, there's some prudence in that. You meet the present need
Yep.
and anticipating, I mean, we know the maintenance need is there going forward regardless. And so we actually have a source to whittle that down, and in 5 years, you bought us time to recalibrate. What are they now? How far have we made a dent in it or not made a dent in it, based on things we can't factor in right now? So I think there's a lot of sense and prudence in that proposal.
If you look at our maintenance spreadsheet, it doesn't end at 5 years. It doesn't end at 20 years. That number is never going down, it's only going up. I don't like the idea of taking referendum after referendum after referendum to the public. We tell them what it really is, we get to there, and then we deal with it. If there's some crazy situation where suddenly our needs go down, that board at that point can simply just say, we're not going to levy that amount. But I cannot see a possible scenario where that ever happens. So why do we want to create multiple referendums?
I think
you're just putting constant stress on the system.
I don't agree with that you're putting constant stress. I think what you're doing is recalibrating, because in 5 years you might need 3 million. You know, and we're talking about building a new school, and theoretically you're going to put some money into that next referendum for deferred maintenance, and it's going to go to deferred maintenance. I think you know, if you have a sunset, you can reevaluate in the future. I think it's prudent.
And just to reiterate that, I think the main reason we've always used recurring is it's always been connected to opening up a new school. The reason why sometimes districts use non-recurring is when it's not necessarily connected to a new school or an expense that's not going away. Either strategy works here and puts us in a better situation than not utilizing either of them. Because you would have, if we don't take action next Monday, we're putting ourselves in a situation where if 6 weeks from now, there's a state budget repair bill that takes 5% off state equalization aid, we will have no action to be able to take. This puts the board in a position of being able to react to that. And either of those strategies works, because this isn't tied to a new building. This just depends on your philosophy, and Dave's point on the maintenance costs are always going to be there. Yes, you can absolutely tie this to the maintenance costs and look at it from that lens. You can also look at it from the lens of, because this isn't tied to a new building, let's change the concept and have it be out there for a period of time. They're just two different approaches for looking at an operational referendum question. So we would just need your guidance on approach so that we have the information ready for you next Monday.
So do you need a motion, or what do you need?
I don't need a motion, just looking to see from the ballot language if that's what the consensus was and whether you wanted it to be brought forward that way or you wanted it to be brought forward the other way.
But we just need input so we can write the language correctly to bring back next week.
I provided my input.
Steve, is there a restriction on number of referendums in the country?
Yes.
And what is that?
I'm sorry. What did you
What?
say, Randy?
I think it's two
Yeah.
in a calendar year.
2 in 1 calendar year,
For either kind of question.
either kind.
Yep.
So if we did recurring one now, that would mean in April, we only have to do one referendum.
You only have one question.
One question. If we do a non-recurring one now, and then we go to April, we have to do 2 of them.
We can't.
One operation, no, because it's in the calendar year. April's a different calendar.
April's.
So you could do 2 in April.
So
But
it's
if
not
one of
within a
them
year.
fails, you don't get to do anything about it in, well, you don't have November anyway, the election's gone. The problem is, having played way too much with referendums while working in the building trades, the more you ask, the less you get. The more times you keep going back with referendums, the more the public starts questioning why you're doing that. I don't like the idea of going in with 2 operational referendums within 6 months. If we can't see that our maintenance budget is a constant recurring concept that will always be there and will not go away, even putting $1 million at our maintenance budget every single year from now on isn't enough. We have years where it's $4 million in 1 year. We have years where it's $2 million in 1 year. We've talked about this so many times. We know the number isn't enough.
So many times, Dave, but I feel more comfortable putting a sunset on these recurring referendums, because I think it makes sense. Go ahead, Mark.
Everything you say, there's a level of logic to it, but the one thing with a sunset on a referendum, you put a sunset on it because the need, you're anticipating the need is gone. And I think that is a good point that Dave's made, that this need is never going to be gone. And so
But
probably, I think it provides, Dave's plan provides more options.
But just because you say, I'm going to do a $2.5 million maintenance referendum into perpetuity, a future board can use that money any way they want. That doesn't tie it to Fund 41 or maintenance or anything like that. It's just there. So future boards can really make a decision on where that funding goes. It doesn't have to go specifically to maintenance.
When you look at recurring or non-recurring, it's really a philosophical and a comfort level in the community. I mean, there's districts that are at referendum every 3 years on a recurring basis for ongoing expenses because that's what they've chosen to do. And that's what their community has wanted them to do to reevaluate kind of where they're at. There's a community that I'm aware of not far from here, a little farther north, that every 3 years is doing that for the last 20 years. And that's just how they operate. And so, but that's their choice. You have other ones that have gone, just as Steve has said, as we have, on a recurring basis. There's not a right or a wrong here. It just causes you then to, so if you're looking at, from your perspective, as far as saying non-recurring would be when the issue's gone, not necessarily, it just means you re-up it. And then you have to go back and share what your needs are. But either one of those options work in this case. The piece that I think that Steve and I've talked about was, and it kind of gets to the point of it does impact a future referendum that we would have, because if we had it recurring, it's going to go into maintenance pieces. If it's non-recurring, it's going to go in to whatever our COVID expenses and maintenance, and then you have to revisit it at a point in the future. It's all philosophically how you want to approach it. Budgetarily,
we're
it doesn't
gonna have to have a motion.
Yeah.
Because I think we're gonna be split.
Well, we're at least going to each say what we want, no matter how you do it.
What we could do is write it out both ways so that you have it, so that you can see it here next week. Because you have to vote. I don't know if you're going to solve it right now in the next little bit, but we could have them write it up both ways. Steve, or does it have to be posted for tonight's meeting differently?
It's been posted with the way it's been presented, but you can amend the agenda. We just wanted to get it in the paper so the public knew we were having a discussion on this topic.
So we can amend the agenda for next week, and we could bring it in both forms so that we can look at it.
I don't know why we couldn't.
Is that something that you'd like? I mean, I'm seeing kind of differences
Yes.
of opinion.
Sounds
Let's
good.
bring
So
it
then
both
you have
ways.
to know if it's on a non-recurring basis, you want to build off of 5 years?
5 years.
5 years? I can have that conversation tomorrow.
Okay, thank you. And then the last topic in here is really food service. So I'm going to ask Connie to come up to the table, and Dean's here to help answer any questions from an elementary school principal perspective. So thanks, Dean, for jumping in, and Connie, thanks for being here. So we've got some options with how we can handle food service. The options are in front of you. Connie's been working since she learned about the decision for educational options to try to put together some food service options. We've got them in order of different approaches. On your handouts that you have in front of you, the first option we have in front of you is the Taher contracts with both Madison Country Day School and the Dane County for the senior center meals. That would be it. So that option is looking at Taher only maintaining the existing contracts, and that would be no food service to the Waunakee School District students. The next option that's included for your consideration would be those same two contracts, so Madison Country Day and Dane County, and adding in a school closure meal program for free and reduced students being provided out of like the high school like we're doing right now. The third option is expanding what we're doing to actually having a meal program operating out of the K through 4 buildings. Connie has a couple of flyers that she's prepared that shows what that would look like. The meal program operating out of the K through 4 schools is more of what I would call our typical approach, where Connie's office processes free and reduced applications, paid families have the opportunity to request a meal, There's both free and reduced as well. The idea of that third option was something that Dean called to my attention, and he could certainly speak to you about, would be to look at like a backpack type approach. The principals aren't looking at, all students going down to the cafeteria. They're looking at an option where the students would be able to have a lunch put in their backpack before they go home, with the idea that some of these students might be going to homes where there's not food prepared for them, or from free and reduced families. So there's really 3 different options. Connie wrote them up and is available for your questions, and Dean is available as well from an elementary school perspective as far as what that might look like. And we're really looking for your input as to where you would like us to see us go with the food service program.
Steve, I've got a question. We've got AM, PM, and I can't believe that a K-4 is going to go home. They're probably going to go to some type of provider, right? Daycare provider, or do you see the bulk of these kids going home? What's your
I'd
feel?
ask Dean. if you
Yeah,
have-
that's a very good question, Jack. And I think realistically, we're going to hope that we're going to be going to some sort of provider, but I don't know. It's hard to say what some family choices will be. I can foresee third graders, fourth graders potentially heading home and no one there.
And staying at home?
Or if they are there, they may have an intermediate or a middle school, high school
Yeah.
brother or sister at home.
So, I mean, it's a hard one to call, but I do know that some families in the past have, having a 10-year-old, they're at home on, if there's a day off of school and there isn't anyone there.
So would there be something for the second group coming? Because the second group comes at what time? 11:30?
Yeah, we're still working on that logistic. But what we would be, actually the day after, so last Tuesday, I think, when I emailed Steve on behalf of the K-4 principals and asked if there was going to be consideration of a breakfast and a lunch opportunity for our families, particularly for the free and reduced, simply because of the fact that they're at school. And if we could send them home with a meal, that'd be fantastic. And likewise for any paid option as well, if that was a possibility, because our half day really isn't truly a half day.
Right.
Right? They're going to be going home at, dismissal would be about 10:20, and then likewise the next group of kids are coming in at 11:30, 12 o'clock. We still haven't got that logistic figured out yet. We have to look on the busing piece.
Well, the reason I ask is some of the kids, if they're at a daycare coming for the PM, many of them don't start serving until 11:15, and they would have no meal at noon then.
Mhm.
And
So-
I guess that, to me, that, I'm not sure if there's a plan for that
Yeah.
situation.
We haven't planned on having any food eaten at school. We're hoping that we can have something provided so they can take it home.
So this concept, Dean, is that you would send it home with them at the conclusion of the AM and the conclusion of the PM.
So they can.
So there was nothing, there's nothing eaten at
So
school.
these numbers would reflect an AM and PM.
Correct, as well as we would offer it to all virtual students, so we could have a distribution pickup time like what we are now. And we would have the staff in version C to do a delivery system again. So those families that don't have the vehicle or the way to get to the car or the meals, we would be able to deliver.
So would you run this more as a traditional food service where people are actually paying for meals? Because I don't think we can go into perpetuity without.
So we would run all of the
someone paying.
meals through their lunch account, like we typically do.
Yeah, that's a great question, Jack. So the third version is intended to be as close to what we previously would have done before. So reduced students do have a small fee if they qualify for reduced. In that option, that would be charged to their family account just like it was before. A paid student would be paying and would have that option available to them. Connie has some flyers that she would prepare that would describe it. It would be as close to normal as we could get, and it would be operating out of the family's meal accounts, as opposed to the second option, which is the students coming to get the meals at the high school. That would not be from their individual accounts. That's just a pickup and basically funded by the district. And so, yes, that would be a big difference.
Yeah, I'm not sure that that's sustainable.
Talking about at the high school type rate. So the main question we're posing to you tonight is, do you want to see food service available in the buildings where students are coming in? The model that Dean is proposing is really, again, them bringing the food home with them, and it would be based on using the individual family meal accounts and Taher processing free and reduced applications like would traditionally be done in a school year.
Question, on the paid one, the third option, are you basing that head count on the total number of students that you're attending?
I did 20% of our previous numbers, so I took 20% of our participation rate.
Of your previous K-4 numbers?
Correct.
So
Or no, I'm
that's
sorry, K-12 numbers.
K-12 numbers, because we're not going to have K-12 numbers.
No, but we would offer this to all virtual students as well for a pickup and or delivery.
I would well,
Do you
my feeling is the virtual students aren't going to come just to buy a lunch meal on 5 through 12. In fact, I have a little doubt on the K-4 as to whether the ones who are there are going to 100% participate. I would think their numbers would be a little bit lower, especially the afternoon ones. Yeah. I personally am absolutely fine with number 2 or number 3. I don't think we're going to generate the income that looks like, but either way, it's going to be better than the negative number on number 2.
Right, with the paid kids, it would help offset the cost of the free and
Right.
reduced kids. And then we would bring in some additional marketing options where, you know, we could do things on, you could see on some of the flyers,
Like the family
the
dinner.
family dinner plan where Chef Brian would prepare something for the family so we could send it home, pick up or delivery.
Our local restaurants may get mad at us.
I think that's going to be a challenge.
I don't know how we don't have, I don't know if we have a choice but to provide option 3, given the model we're going forward with, the number of kids whose noon hour is compromised by the schedule.
I don't think it's going to be as rosy as number 3 looks, where it's only $2,000 down. But
it may not be.
no matter what, it's not going to be negative 30,000.
Right.
And we survived negative 30,000 in the spring. How much did that account actually bring in of donations? I never even.
15,000 probably.
So, I mean, we can encourage that again, but I think personally, I'm fine with voting for 2 or 3, and I probably favor 3.
You favor what?
Number 3, because, you know, why not?
Yeah, I think we need to provide something. I want, the kids or the families that are going to need them may come like they did this summer or the spring. But I think we should be catered for. I don't want them to go to a lunchroom, but if you can slip something in there for lunch.
Would you make?
Because they may not be
make a
going home.
motion?
Make a motion that we accept version 3.
Second.
There's a second, more discussion. You had something, Mike?
No.
Anything else? All those in favor of option 3, say aye.
Aye.
All those opposed, say no. And Title IX policy changes.
I think we're going to bring Brian back here real quickly. What you find in your packet is a very long policy with Title IX. That's been an item that Kurt Ely and Brian Gabarski have been working on and following for a while, as we've been anticipating that there's been changes with requirements for that. One of the things that Brian is bringing forward here tonight is a policy for us to adopt. I realize this is not following our traditional practice of bringing it through the policy committee. Lots of meetings have been taking place around Title IX, but as far as the guidance on actually the writing of the policies has been something that is actually just occurring at this moment, and some of them occurring after the implementation of the policy needs to be in place. So Brian has pulled together with multiple samples a policy for us to review tonight. We are asking this to be voted upon tonight, as it does need to be in place in just the next few weeks. So apologize for the short notice, but this is one of those requirements that had a lot of training on, but then when it got to the point where we were getting guidance on what needs to actually be in the policy, that's been pretty shortcoming. So with that, Brian, I'll let you hit the highlights and open it up for any questions.
This is this policy is a result of, probably as the kind of the board book describes, one of the more major overhauls of Title IX since it's been put into existence. At the beginning of summer, the Department of Education released 122 pages of regulations that have some really major procedural changes to them. They went through, this had gone through the full, I forget what the process is that I identified in the board book, but the full opportunity for public comments and review. So it's not guidance, it's has the weight of law behind it. And it really, as I mentioned, has some very clearly defined procedures because it's heavily concerned with due process from both sides of the parties, the accused and the accuser, if you would. With that amount of regulations that got released, as Randy said, it took some significant time for those groups that advise schools what we needed to do to meet them. Services like Neola and WASB that write example policies actually didn't release their example templates until early July. Law firms started to do the advising, just overview of them late June, and actually it's ongoing now. For example, our school attorney will be doing, his firm will be doing a training for us on Friday. So guidance has been a little slow to get provided due to the depth of what it's asked. This policy is really the result of 5 different schools that shared with me what they had created through either their conjunction with their law firm or with their policy service that they subscribe to. And then it obviously has been personalized to Waunakee as it references our policies within it. And the only thing I guess I would add to Randy's explanation is that it is, we obviously have other policies that in the past referenced Title IX. Those procedures are not, they don't meet what this requires. And so while we can use those for other types of harassment, for example, or other types of discrimination claims, because they are You know, they are thorough in their own way and in a process that works. They do not meet the legal requirement, which is, as you can see within this policy, pretty extensive. So that's the reason why peeled Title IX out of the policies that it was in, created its own policy and very extensive set of procedures.
I went through the whole thing, and it's indeed very extensive. I guess my question with allusion to those other policies, could that be homework down the road then to decide which ones we no longer need because it replicates this policy?
Actually, there was no, as I referenced those there was
For harassment?
Yeah, they should remain in place. Because, for example, Mark, I would say something very unique to Title IX, or at least the new regulations, is that if this Title IX does not apply, for example, on a trip that's outside of the United States. And so if we had an issue that could potentially be Title IX related, but it occurred on the trip to Canada, or it occurred on the trip to Spain, or to Title IX would immediately be thrown out, but that doesn't mean that it isn't something that we would need to pursue within our other harassment or discrimination policies. So they really should continue to exist, but if it does fall into Title IX, this is exactly how we got to go through it, because it's very prescriptive.
So this is really mandated by law?
It's absolutely mandated by law.
So I would say, I would make a motion to approve.
Seconded.
Any discussion? All those in favor say aye.
Aye.
All those opposed? And motion carries.
Thank you, Brian.
So next, we have resolution for a district expulsion officer. So we just need a motion for the exact resolution as you see it in the board book.
Motion for the resolution is drafted in the board book.
Second.
This has to be by roll call vote. Is there any discussion or question on this? And on a roll call vote, Jack?
Aye.
Aye.
Mark?
Mike?
Mike?
Aye.
Mark?
Aye.
Brian?
Aye.
And you?
Aye.
Dave? Aye. Now we have to appoint a district expulsion hearing officer, which the recommendation from the administration is that basically we appoint John Anderson, who's been currently serving as ours, on an interim basis until the October meeting, when we'll have recommendations from our board's attorney.
And I apologize to the board, this is something that we had talked about last year for a number of reasons of what happened this year. We just didn't get to that. And I just propose that if there's anyone that you'd like me to reach out to, I'll be happy to do that. Otherwise, I'll work with Kirk. He has a list of names of other people who do this type of work, and I can get proposals from them and bring it back. I put the October board meetings, I felt that would be a reasonable time for us to do so.
Motion to approve Attorney Anderson as an interim expulsion officer.
Second.
Any discussion? All those in favor say aye.
Aye.
All those opposed? Next, we have appointing our medical advisor, Dr. Bill Rannon, for the 2020-2021 school year. He did accept if we do appoint him.
I move we appoint Dr. Ryan as our medical advisor for the 2021 school year.
Second.
Roll call.
Any discussion?
I guess my question would be, do we have any other options? No offense to Dr. Ranum at all, but I haven't heard anything from him at all in the last 6 months, at least at a board level. So I don't know, Randy, if you hear from him a lot or you talk to him a lot, but you have a lot of health things that I just haven't heard from him at all.
Yeah, and usually he's somebody that our nurses and Kurt reach out to.
Okay.
So, yeah, that's usually, it's usually at our prompting is where we'll reach out to Bill.
Okay.
I mean, we would have other options, I just haven't pursued any.
If you're good to go, that's fine for me, but that was my main question.
Then we do roll call again. Jack?
Aye.
Joan?
Aye.
Mike?
Aye.
Mark?
Aye.
Brian? And Jude?
Aye.
And Dave, aye. And announcements or correspondence? No. The consent agenda, you can take it as a whole or pull out any items anyone wishes pulled out.
Make a motion to approve.
Just note that the co-curricular was pulled out until next meeting. There's a motion to approve. Is there a second?
Second.
Any discussion?
Who was second?
Brian.
All those in favor say aye.
Aye.
All those opposed say no. And board business, had enough of that. Unless anyone has anything to bring up, then we go on to setting any meetings.
We've already set this meeting, but next Monday, we're back here. We have the resolution we talked about within the budget committee, and then we'll also bring back the co-curricular piece. So that'll be what we'll have next week. I don't have any other committees that I need right now.
Okay. Then, is there a motion to adjourn?
Oh, motion to adjourn.
Is there a second?
Second. Give it to Judy.
Any discussion? No.
No.
All those in favor say aye.
Aye.
All those opposed stay here until next Monday.